Hello, everyone. Let's continue the session. I guess I'm live. Just a second. Give me a minute. I guess everything is good to go, right?
Yes, my dear, like.
Okay, thank you so much. We can disconnect. Okay, I welcome you all for today's session. Okay, I mean, we were already live and for the important announcement, we were disconnected. I guess you all have attended search session and now we will continue with the microbiology. Specifically for the FMGE aspirants, we are going to continue this. So we have to continue this anyways. Okay. So we have already completed the general microbiology and now I'm starting with bacteriology directly. So let me first finish bacterio, viro, parasito, myco. In the end, we will have a look on the immuno. Okay. So let me continue with bacteriology. Are you people there? Can we start? Can we start with bacteriology? Give me a thumbs up in the chat box if everything is good to go. I'm visible, audible, everything is good to go. Can we continue? So let's start bacteriology. So I guess everyone knows this classification. We have already discussed this classification, the classification of the bacteria, the gram-positive cocci, gram-negative cocci, gram-positive bacilli, and gram-negative bacilli. So we classify the bacteria in the 4 categories. They are in front of you. We have already seen the classification in the last session. Okay, now here the important bacteria from each category I will discuss. So I will discuss both the important bacteria, Staphylococcus, Streptococcus, because every year you get a clinical based question from one of these two. Ultra important. So we will continue with the two bacteria, Staphylococcus, Streptococcus. After that, I will teach you the Neisseria also. And from the gram-positive bacilli, I will teach you 3 bacteria, Bacillus, Clostridium, and Diphtheria, the ultra important 3. And gram-negative bacilli, I will teach you Enterobacteriaceae, Vibrio, Haemophilus, and few important other ones. From the miscellaneous, I will teach you Rickettsia. Because in the limited time span, I cannot cover each and every bacteria, but the ultra important, more than 70-80% of the bacteria we are going to cover right now. But in the sequence only, I'm going to cover. Okay. Okay. Is the voice is clear? Audibility, audio, video, everything is clear? Okay, thank you, thank you. Okay, so let's continue. So let's continue with the Staphylococcus and Streptococcus gram-positive cocci. I'm starting with gram-positive cocci. Okay. Staphylococcus, Streptococcus. So we know in gram-positive cocci, we are having 2 bacteria, Staphylococcus and Streptococcus. How to differentiate the two? Both of them are gram-positive cocci. We are having 2 gram-positive cocci, Staph and Strep. My point is that because both of them are gram-positive cocci, both of them are spherical in shape. And both of them are violet color because they both are gram-positive. They are violet in color. And both of them are cocci. That's why they are spherical in shape. So how to differentiate between Staph and Strep? My first question to you, how to differentiate? So there are 2 ways by which we can differentiate between the two. You can see Staphylococcus is arranged in clusters. You can see they are arranged in clusters, like the clusters of the grapes. Angur ki guchchon ke jaise hain. So these are the clusters of the grapes you can see like. And the Streptococcus are arranged in the chains. Can you see the Streptococcus is arranged in chains and Staphylococcus is arranged in the cluster of the grapes you can see here. So please see the arrangement is different. The first thing, the arrangement is different. The second thing, the ultra important test to differentiate between them is catalase test. What do you mean by catalase test? Here in the image, you can see the Staphylococcus is catalase positive. You can see the bubbles are coming. And Streptococcus is catalase negative because no bubbles are coming. You may be thinking, ma'am, what are these bubbles and how to perform catalase test? What is the principle and how to differentiate Staph and Strep based on the catalase test? Let me explain what do you mean by catalase. Actually, catalase is an enzyme. You got my point. The catalase is an enzyme. You can see we are talking about the 2 bacteria, Staphylococcus and Streptococcus. Staphylococcus, the cytoplasm of this contain catalase. You can see this is Staphylococcus. Can you see the cytoplasm? Can you see in the cytoplasm? There is an enzyme. The name of the enzyme is catalase. It is catalase positive. Can you see the Streptococcus? Here in the cytoplasm, no such enzyme is present. So it is catalase negative. So how to perform the test? Can you see I'm having 2 specimens with me? Have a look. So this is Staphylococcus. This is Streptococcus. So can you see the 2 specimens? I'm having one Staphylococcus, one Streptococcus, the 2 specimen. But I don't know which test tube contain which one. One of them is Staphylococcus, one of them is Streptococcus. I know both of them are gram-positive cocci, but I don't know which one is which. So by performing catalase test, I want to know which one is catalase positive, that is Staphylococcus, and which one is catalase negative, that is Streptococcus. So how to perform the test? So basically what you have to do, you have to take 1 drop of H2O2 on the slide. So let's take one drop of H2O2, hydrogen peroxide. It's commercially available and it's a liquid. So let's take one drop of H2O2 on the slide. It's commercially available. Just take one drop. Just take one drop of H2O2 like this. Now put your specimen. One drop of Staphylococcus here and one drop of your specimen here. Whatever is your specimen, whether it contains Staphylococcus or Streptococcus, just mix with the H2O2 and mix it with a stirrer. Mix it with a stirrer. So basically, you know that if it is Staphylococcus, the Staphylococcus have the enzyme. Name the enzyme catalase. Catalase will degrade the H2O2. It will degrade the H2O2 into H2O and oxygen. So as soon as you mix the two, you can see the bubbles of oxygen are coming. As soon as you mix the two, you can see the bubbles are erupting, the bubbles are coming. And here in Streptococcus, this enzyme is absent. So H2O2 will remain as H2O2 only. It will remain as liquid only. The H2O2 will remain as H2O2 only. It will remain as liquid only because enzyme is absent. So here no bubbles are seen. You can see here no bubbles are seen. So what I have to do, for example, I'm having a specimen. Just suppose this is my specimen. I want to know, is it staph or is it strap? But I know it is a GPC because it is having the violet sphere. So it is having violet color sphere and I'm sure it is GPC, but I'm not sure is it staph or strap. So you say, ma'am, it's okay. Take a slide. Take one drop of your specimen. Put one drop of H2O2. Mix the two with a stirrer. Look for the bubbles. If the bubbles are coming, it's Staphylococcus. If no bubbles are coming, it's Streptococcus. So basically, it is the bubbles of oxygen which differentiate the two. How many of you got it? Now, based on this image, can you see this image? Everyone, have a look on this image. See this image. Based on this image, you can get 3 questions. Number 1, name the test. Anna, you are getting the image. You can see this image is showing catalase test. The bubbles are present. Number 2, name the gas of which the bubbles are seen. Is it oxygen, nitrogen, helium, hydrogen? So it is oxygen. Number 3, name this bacteria. Let's name it is A, it is B. So what is A, what is B? So A is Staphylococcus and B is Streptococcus. If they provide it as a GPC. Out of the GPC, A is Staphylococcus, B is Streptococcus. So based on the image is 1, but we can make multiple questions. So what is your question? Do we take specimen? Broth, or we can take both. We can take the specimen from the broth also and culture plate also, whatever specimen you require. So you have to first, from the culture plate also, you have to, mix it in a saline broth. So better to take in drop in liquid form, the specimen. Okay. So this is the catalase test. This is how we perform. Okay. Now we will talk about Staphylococcus. So let's talk about gram-positive cocci. The first test we are performing is catalase test. Based on the catalase test, we differentiate, is it catalase positive or catalase negative? If it is catalase positive, it is Staphylococcus. And if it is catalase negative, it's Streptococcus. So let's talk about Staphylococcus. We will continue Streptococcus later on. Let's hold it. The next chapter, I will continue it. Let me first finish Staphylococcus. How to further classify? So further we classify based on another test. The another test is coagulase. What's the another test here? The another test here is coagulase test. Got my point? Coagulase. So only one Staphylococcus, the main hero, I call it main hero. The main hero of this movie, Staph aureus, Staphylococcus, it is coagulase positive. And rest all the side heroes, I call them side heroes, not the main hero. The side heroes are coagulase negative. Okay, all the coagulase negative together are known as cones. What is the full form of cones? It is CO is coagulase. Coagulase negative Staphylococcus. These are known as cones. So basically, we have 2 side heroes. It's a movie having 3 heroes. One is main, that is Staph aureus, and we are having the 2 side heroes. Who are my 2 side heroes? Who are the 2 side heroes? We have Staph epidermidis and Staph saprophyticus. You can see Staph epidermidis and Staph saprophyticus. These are 2. So how to differentiate these 2 side heroes from each other? How to differentiate? So we have the third and the last test. The third and the last test is novobiosyn susceptibility test. It's novobiosyn susceptibility test. The epidermidis is very, it's very weak. It get dead. When we put novobiosyn over it, it is susceptible, it will die. But saprophyticus, it's very strong. As for saprophyticus, I learned like that. As for saprophyticus and as for strong, it's very strong. Even on putting novobiosyn, it will not die. So it is resistant. So how to perform novobiosyn test? This is how we perform novobiosyn test. So we take a nutrient agar. This is nutrient agar. This is also nutrient agar. Okay, or this is a culture plate. We take a filter paper, circular filter paper, circle filter paper. We dip it in novobiosyn and place it at the center. So here also we place it at the center, the novobiosyn. Here also we place it at the center, the novobacillus. Now try to do the lawn culture of the bacteria. Hello? It's not streak culture, it's lawn culture. So you can see the yellow is the colonies. Can you see here the bacteria is growing? The bacteria is growing, but it is forming a zone of inhibition. It is growing away from the novobacillus. It is not coming closer to the novobacillus, because if the yellow bacterial colonies are coming closer to the novobacillus, it will get dead. So this is susceptible. This one is susceptible. It is epidermidis. But here in the second diagram, you can see the bacterial colonies are coming closer to the rim of the novobacillus, because they are not afraid of novobacillus. Okay, so this one is resistant. It do not get afraid of novobacillus, and this one is saprophyticus. So this is antibiotic susceptibility test. Novobacillus is a chemical, it's a drug like penicillin, like cephalosporin. So we take a filter paper and do this test like this. So how many of you got it? So we are doing 3 tests. See the yellow color. So what is the first test? The first test we are performing here. The first test we are performing is catalase test, which differentiates staph and strep. The second test we are performing here is coagulase test, which differentiate the main hero from the side hero. The main hero is the staph aureus, the side heroes are the cones. And the third test we perform is novobacillus susceptibility test, which differentiate the 2 side heroes among themselves. One of them is very weak, darpoke hai, and one of them is strong. As for saprophyticus, the saprophyticus one is resistant and the other one is very weak, that is epidermidis. How many of you got it? Give me a thumbs up. So let me ask you 3 questions. Let me ask you 3 questions, 3 answers. First, okay, the first question, catalase test differentiate what from what? The second test, coagulase test differentiate what from what? And third, novobacillus susceptibility test differentiate what from what? 3 questions, 3 answers. Okay, so let's start it. So catalase test differentiate what from what? Catalase positive, catalase negative. Who's catalase positive? Catalase positive is staph and catalase negative is strep. So catalase test differentiates staphylococcus from streptococcus. Basically, it is differentiating 2 GPC from each other. Say yes. Please write down in the chat box quickly. What is the answer? The second question, coagulase test differentiate what and what? Who's coagulase positive and who's coagulase negative? So coagulase test differentiate the staphylococcus from each other. The various types of staphylococcus. We have 1 main hero and 2 side hero. So basically, it's a test which differentiate the main hero from the side hero. So who's the main hero? Staph aureus. I call it the main hero. And who are the 2 side heroes? I call the side heroes as coagulase CO. Negative staphylococcus cones. They are 2. Okay. And the third and the last test, novobacillus susceptibility test. What does it differentiate? Novobacillus susceptibility test differentiate the 2 cones among themselves, the 2 side heroes. The 2 side heroes among themselves. So one of them is susceptible, that is very darpoke, very weak. And one of them is strong, S for strong. Okay. So tell me the names. So susceptible one is staph epidermidis. And the strong one is staph saprophyticus. S for strong and S for saprophyticus. This is how I learned. How many of you got it? How many? If you got this, I'm having 7 questions. Give me a thumbs up. Everyone give me a thumbs up. Let me ask you 7 questions in a sequence. I want 7 answers in a sequence right now. Please be prepared. Okay, the 7 questions are in front of you. Tell me the answers. These are basically the clues given in your question. Say the answer of the first question. Write down in the chat box. Please, everyone participate. Tell me GPC. Quick. How many GPCs you know? Say, ma'am, only 2. Staph, strep. That's it. So write down the 2 GPCs. Staph and strep. Khatam. That's it. Okay, I cannot say further. Give me more information. Tell me a GPC which is catalase negative. So yes, I can say it's strep. It's streptococcus, but not staphylococcus. Tell me a GPC which is catalase positive. It's a GPC. We have only 2 GPCs now. Catalase positive is staphylococcus. So answer of third is staphylococcus. Okay. Tell me a GPC which is catalase positive. So of course it's staphylococcus, but it is coagulase also positive. So I can tell you which staphylococcus, the main hero. It's staph aureus. So my answer is staph aureus. How many of you got it? Tell me a GPC which is catalase positive. So of course it's staphylococcus, but which staphylococcus? It's coagulase negative. So it's cones, the side heroes. Which cones? I don't know. So if you want to know which cones, the last 2 questions are in front of you. One of them is novobacillus susceptible and one of them is novobacillus resistant. Okay, you can see one of them is novobacillus susceptible, one of them is novobacillus resistant. So the susceptible one is epidermidis and the resistant is strong. Okay, it is not killing, it is not getting dead with the novobasin. So the resistant one is saprophyticus. How many of you got it? So these are the questions you can see. You will not get direct one-liner question as I have put. No, you will not get. You will get the clues in the question. You will get a big clinical question. There is a 47-year-old man presented with tonsillitis, presented with blah, 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 blah. On biochemical reactions, this is the thing we found, or on culture, this is the thing we found. So they will give you the clues. So you have to pick up the clues and reach on the conclusion. They will help you a lot. People, give me a thumbs up. How many of you got it? So this is the approach-based microbiology. How many of you got it? Can we go ahead? Can we go ahead? Now, we are talking about the main hero. I'm interested in the main hero. Who's the main hero? Staph aureus. Now I will tell you, Staph aureus secrete 4 toxin. Okay. Staph aureus secrete 4 toxin. 1, 2, 3, 4. The 4 toxin causes 4 disease. 1, 2, 3, 4. I want to tell you the name of the 4 toxins along with 4 disease. That's it. That's it. Okay. So what are the 4 toxins? What are the 4 toxins secreted by Staph aureus? Currently, I am teaching you Staph aureus. Staph aureus. Tell me the 4 toxins secreted by Staph aureus. The name itself depicts. One is cytolytic toxin. देखो नाम में ही उसका मतलब है. The name itself depicts its meaning. Cyto means cell. Lytic means rupture. So it is a toxin which is causing rupture of the cell. So it causes a disease that is pus everywhere in the body. Pus-filled lesion. It can be furuncle, it can be carbuncle, it can be abscess, pus. Okay, anywhere pus. Cytolytic toxin. Okay, the second toxin. So this one was cytolytic toxin. See the second toxin. Second is enterotoxin. Have a look. Enterotoxin. What do you mean by entero? Entero matlab intestine. You know, enterocytes, intestine. So it is a toxin which leads to food poisoning. Okay, it will lead to food poisoning. The third toxin you can see, toxic shock syndrome toxin. Toxic shock syndrome toxin, it will lead to toxic shock syndrome as the name indicates. And the last toxin, epidermolytic toxin. Epidermis, also known as exfoliative. Write down other name, exfoliative toxin, also known as exfoliative. So it separates the epidermis from the dermis of the skin, and it causes a disease in which the epidermis gets separated from dermis. It is known as SSSS. So this is the toxin which leads to SSSS. Okay, so 4 toxin with the 4 disease. How many of you got it? Okay, you can ask the doubts here. It's very difficult for me to manage the chat at the Zoom also and at the YouTube chat also. You know, I'm having a mobile, so I can open the chat at one place. Anna, I cannot open the chat at the 2 places, people. You can write down your doubt here. Open hammer. If you have any doubt, please write down here. I'm having an eye on the chat box, and I will definitely clarify your doubt if you are having it. Because it's very difficult for me to open the chat in the Zoom also and to open the chat in the YouTube also. And having a screen in front of me. So managing 3 things together, it's very difficult. I hope you can understand. Please ask your doubt here, please. Hannah, you're most welcome to ask your doubt here. Okay, anyways. So let's go ahead. I was telling you 4 types. 4 types of toxins. Okay, the 4 types of toxins with the 4 type of diseases. Okay, first let me tell you the diseases also, then we will revise the 4 toxins with the 4 diseases. Staph aureus. I'm teaching you the main hero. So the first toxin, cytolytic toxin, it is causing pus everywhere. Pus-filled lesion. It can be cellulitis, abscess, furuncle, folliculitis. You can see pus everywhere. Okay, cytolytic toxin. The second toxin is enterotoxin. Enterotoxin. It causes food poisoning. Hello, food poisoning. Entero means intestine. Now, it's the first organism I'm teaching you food poisoning. Hello, that's why I'm telling you approach. Now, whenever any question in microbiology coming based on food poisoning, you have to see 3 things. Food poisoning ka approach. You have to see 3 things. Number 1, incubation period. After eating the food, when does the symptoms appear? After how many hours? So there are 3 categories. Whether the symptom occurs between 2 to 6 hours, between 6 to 16 hours, or more than 16 hours. In which category your organism is coming? So different categories have different differentials. Here we have only 2 bacteria. Here we have only 2 organisms. Here remaining all will come in this category. Okay, so based on that. So first look at the incubation period, the first thing. The second thing, you have to see the food. So different organisms have different propensity for the food. For example, Staph aureus. This enterotoxin enter via meat, dairy product. If we talk about the Bacillus cereus, it enters via fried rice, Chinese fried rice. You know, if we talk about the Clostridium difficile, so it will enter via canned food, the food which is present in the canes, preservatives. So the different food item for different toxins. Got my point? Now coming on the, this is Clostridium botulinum, by the way. Okay. Now coming on the third thing. The third thing here you have to look for is the symptom. Is the patient having only diarrhea, only vomiting, or diarrhea plus vomiting both? So currently, I'm not interested in complete food poisoning. I'm interested in food poisoning of my bacteria, which I'm teaching you right now. I'm teaching you Staph aureus. So let me tell you the three things for the Staph aureus food poisoning. Staph aureus food poisoning occurs between 2 to 6 hours. You will get a typical question. There is a party going on. Hana, within 4 hours, 5 hours, multiple people in that party have diarrhea and vomiting. It causes diarrhea as well as vomiting. Not only diarrhea, not only vomiting, it causes both. Number 2. And the food preferred is the dairy product. You typically get a question of pastry party. In the pastry, the cream of the pastry is a dairy product. You will get a cheese pizza party. The cheese is the culprit. The cheese is the dairy product. Or the fish or meat party. Got it. So the food you have to tell me. So this is the food poisoning approach. Hana? So what is Staph aureus? What is the incubation period? Say, ma'am, 2 to 6 hours. What is the food item? Meat, fish, and dairy product. And it is causing diarrhea as well as vomiting. Have a look on the diagram. Beautiful diagram. Hana? Diagram ऐसा होना चाहिए कि इंसान को बोलने की जरूरत ना पड़े. See, the diagram is self-depictive. Let me explain. Can you see the organism? If I don't tell you the name of this organism, you can understand. Say, ma'am, these are violet color, these are sphere, and these are in clusters. So, of course, it's Staph aureus. These are violet color, these are sphere, these are in clusters. Come on, it's Staph aureus. See the food items shown to you. Hana, you have shown a milk, pizza, Hana, meat, paneer, okay, fish. So, meat, dairy products. Now, listen, what the person is eating. The person is eating the food containing the toxin, not the bacteria. Person is not eating the bacteria. Person is eating the toxin secreted by the bacteria. I mean, it's a preformed toxin. That's why it's very fast acting within 2 to 6 hours because the toxin is preformed here. The point to be picked here, the toxin is preformed. The person is eating the toxin, not the bacteria. Okay. The toxin goes inside in the stomach, in the intestine, it will get absorbed. It will go in the blood. Via blood, it will go in the brain, stimulate the vomiting center in the brain, person have vomit. And it will stimulate the vagus in the brain. The person have peristalsis and person have diarrhea. So this is the mechanism of vomiting and diarrhea. Everyone give me a thumbs up. This is approach. This is approach. Okay. Got my point? Got my point? Fried egg is the appearance of multiple colonies which we see in fungus and bacteria in Mycoplasma and Malassezia purpura, Goji neni. It is not the food item for any particular food poisoning. Got my point? How many of you got it? How many of you got it? Can we go ahead? So this is the food poisoning. So we have seen the pus, we have seen the food poisoning. The third disease is toxic shock syndrome. Toxic shock syndrome. What is the root of food poisoning here? How it is entering in human body? Say, ma'am, eating. Via eating, ingestion, it is entering. But toxic shock syndrome toxin, it enters in human body via vaginal route. So the female who is menstruating, it's the young female who is menstruating and who is using tampons. So contaminated tampons contain toxic shock syndrome toxin. It enters via vaginal route. And after entering, it goes in the blood. Via blood, it involves multiple organs. So the person have toxic shock syndrome. The female have toxic shock syndrome. It's a multi-system disease. So you will get a typical question. The question is very peculiar, very typical. The starting of the question is there is a young menstruating female presented to emergency department on day 2 or day 3 of menstruation. Samajh jao, they are talking about Staph aureus toxic shock syndrome. So here the toxic shock syndrome typically occurs. It typically occurs in menstruating female. And the last disease, which is caused by exfoliative toxin or epidermolytic toxin, it is the epidermis gets separated from dermis. Can you see the epidermis gets separated from dermis in this image? Here also in this image, you can see the epidermis is separated from the dermis. So when epidermis is separated from dermis, it is known as Nicolsi sign. Nicolsi. Epidermis gets separated from dermis. It is known as Nicolsi sign. And the name of the disease is known as SSSS, Staphylococcus scarlet skin syndrome. SSSS, Staphylococcus scarlet skin syndrome. So we are done. We are done with Staphylococcus. How many of you got it? Tell me Staph aureus. Summary. Tell me the 4 toxins with the 4 diseases. What are the 4 toxins? Say, ma'am, cytolytic toxin, enterotoxin. The third toxin is toxic shock syndrome toxin and epidermolytic toxin, also known as exfoliative toxin. Tell me the diseases. Cytolytic toxin causes all pus-filled lesion. You know the various names. Enterotoxin causes food poisoning. You know the incubation period. You know the food. You know the symptoms. You know the mechanism of the symptoms. Toxic shock syndrome occurs in menstruating female, okay? And multi-system involvement through contaminated tampons. And epidermolytic toxin causes SSSS, also known as Nichols sign, in which epidermis gets separated from dermis. Give me a thumbs up. Everyone give me a thumbs up. Got it? Anyone have any confusion? Coming on the next bacteria. The next bacteria, it's a very important and ultra important bacteria on which you get many questions, Streptococcus. We are done with Staphylococcus, people. हो गया Staphylococcus. Streptococcus शुरू करते हैं. So let's start Streptococcus. Can I start Streptococcus? Huh? First thing is the classification. We have already seen the classification of Staphylococcus. Now let me tell you the classification of Streptococcus. The classification of the Streptococcus based on blood agar, hemolysis on blood agar. Is it alpha, beta, or gamma? What do you mean? I am damn sure many people even don't know what is alpha hemolysis on blood agar, what is beta hemolysis on blood agar, and what is gamma hemolysis on blood agar. Do you know that? Let me tell you. Can you see these three are blood agar? On the blood agar, we have RBCs, of course. Hana? These are the colonies. You can see this is a colony of the bacteria. You can see this is a colony. The blue color or black color colonies I have shown. The colonies of the bacteria growing on the blood agar. Now, everywhere is the RBC. Everywhere is the RBC. Hello? Here, RBCs are everywhere. I'm interested in the RBCs just around the colony. So, these are the RBCs just around the colony. So, basically, the bacteria present in the colony partially, I use the word partially hemolyzing the RBC. So, RBCs around the colony get partially hemolyzed. They get partially hemolyzed. So, this is known as alpha hemolysis. So, around the colony, there is a greenish zone. Colony is there, but around the colony, a green color zone is there. That is partial hemolysis, and that is known as alpha hemolysis. The second thing is that some of the bacteria present in the colony, they completely hemolyze the RBCs present around them. Complete, not partial. So here, complete hemolysis is there. So around the colony, you will get, you can see the colony, and around the colony, you can get a translucent zone. This is known as beta hemolysis. Beta is always complete. And there are some bacteria which not at all lyse the RBC. Neither partial nor complete. RBC remains as it is. Neither they are partially hemolyzed nor they are completely. So they are as it is. So around the colony, you will get no zone of hemolysis. So no hemolysis is gamma. So partial hemolysis is alpha, complete hemolysis is beta, and no hemolysis is gamma. How many of you got it? How many of you got it? Say yes if you got it. Huh? So these are the three types of hemolysis. What you are asking, Dr. Strange? Yes. With female condom also, toxic shock syndrome is common, which I taught you in Steph aureus toxin, toxic shock syndrome toxin. So basically, if the female condom or the female diaphragm is left in the vagina for more than 6 hours after sexual intercourse, then it causes toxic shock syndrome. So it is always advisable to the female to remove the condom or the diaphragm after sexual intercourse. Otherwise, the side effect is always toxic shock syndrome. That can also be a possibility. Absolutely right. Okay, so can we go ahead? Huh? Yes. PDF will be provided, the annotated one, after the session. Okay. So let me tell you the classification of the Streptococcus. Streptococcus are divided in 3 categories: alpha hemolytic, beta hemolytic, and gamma hemolytic. Please understand, you get questions on classification. There are only 2 alpha hemolytic Streptococcus. The names are in front of you. Please read the name. Streptococcus pneumoniae and viridians. Have a look. Have a look on the names. Can you see the 2 names? Streptococcus pneumoniae, viridians. That's it. The 2 alpha hemolytic. Pneumoniae, viridians. Khatam. Pneumonia and viridians. Gamma is only one, Enterococcus. Gamma is only one, that is Enterococcus, you can see. That's the gamma. Okay. So we have 2 alpha, 1 gamma. How many beta? Beta are 20. Yes, beta are 20 in number. You will say, ma'am, what is the basis of these 20? What is different in all these 20? So see, this is the bacteria. Let me draw the bacteria here. Oh, no, this is the bacteria. This is the cell wall of the bacteria. In the bacteria, there is a carbohydrate, C carbohydrate. It is of 20 type. This carbohydrate is of 20 type. That's why it is of 20 different type. Who has done this classification? This classification is done by Lansfield. Okay. And what is the name of these 20? It is A to B. Group A, Group B, Group C, Group D, Group E, Group F. Except IJ, everything is there. A to B. A, B, C, D, E, F, G, H, I, J, K, likewise. A to B. Okay. And this is done by Lansfield based on C carbohydrate in the cell wall. Among them, the most important is Group A. Group A. In our syllabus, the only 2 are there, A and B. I will not teach you all. I will teach you 2, A and B. A is ultra important. The name of A is Streptococcus pyogenes, which is further of 100 types. This one was 20 type. This is of 100 type. The group A among them. And this classification is done by Griffith. What is the difference in all these 100? Now, in the cell wall, there is a protein. The name of the protein is M protein. And this protein is of 100 type, based on which it is of 100 type. So this classification is based on M protein, based in the which is present in the cell wall. And here the numbering is done. The alphabets are already over, no? We have first done the classification based on alphabet A to B. And now we have done the numbering 1 to 100. How many of you got it? So this is the classification of Streptococcus, people. Let's revise it. Streptococcus. How many type of Streptococcus are there in our syllabus? Huh? Three type of Streptococcus: alpha, beta, and gamma. Alpha hemolytic, beta hemolytic, and gamma hemolytic. Alpha hemolytic, there are only two: Streptococcus pneumoniae and Streptococcus viridans. Okay, gamma is only one, Enterococcus. Beta are 20 different types. Beta is of 20 different types. This classification done by Lansfield based on C carbohydrate present in the cell wall, and the name is A to B. A to B except IJ. Among them, the group A is ultra important, which is further divided into 100 types. This classification is done by Griffith. Okay, and this is based on M protein in the cell wall. And here the numbering 1 to 100 is done. Now, how to learn that? You will get confused in the exam. So I'm having a mnemonic. Absolutely right, Ashish. Absolutely right. The mnemonic is Lucknow City, good morning. Lucknow City, good morning. LCGM. I want you to learn this. LCGM. Lucknow City, good morning. So Lansfield has done classification on C carbohydrate. Lansfield has done classification on C carbohydrate into 20 types. So Lucknow City 20. And Griffith has done classification on M protein into 100 types. So good morning 100. So what is my mnemonic? What is my mnemonic? No, I will never forget. Okay. Lucknow City, good morning. This is how I learned and I never forget. So Lansfield has done classification based on C carbohydrate into 20 types. Among them, group A is important. And A is classified by Griffith based on M protein into 100 types from 1 to 100. And you will never forget. Say the mnemonic. The mnemonic is Lucknow City, good morning. Are you people learning, enjoying? Say yes if you got it. Give me a thumbs up. So please learn that. Okay. So basically, I want to teach you 5 Streptococcus right now. All of them are main heroes, you can say. Okay. 2 of them are alpha. I will teach you both. Okay. 2 of them are beta. Actually, beta are 20, but definitely I will not teach you 20. Group A, Group B, A to B. But I will teach you first 2. Group A and Group B, which are ultra important. In your syllabus, only 2 are there. Okay. So what is Group A? Group A is Streptococcus pyogenes. And what is Group B? Group B is Streptococcus agalacti. So I will teach you these 2. Okay. And gamma is only one Enterococcus. Count how many are there? 5. How many Streptococcus I will teach you? 5. So basically, I will teach you the main important point in each of them. The main biochemical reaction, the unique reaction in each of them and diseases by them. Quickly, in 1 minute, we will cover one. In the next 5 minutes, this chapter is over. Can I continue? Give me a thumbs up. Give me a thumbs up, everyone. Can I continue? So let's come on pneumonia. So in this sequence only I will take. Let's come on the pneumonia one by one. Tell me the unique reactions. What is pneumonia? Pneumonia के बारे में क्या-क्या questions आते हैं in your exam? So pneumonia is arranged in pairs. They all are in chain. We are studying Streptococcus, by the way. Streptococcus are in chain. They all are in chain except pneumonia. Pneumonia is in pairs. See, it's in pairs. Let me draw. It's like this. It's flame shaped. It's flame shaped. And it's in pairs. I call it pairs. Jode mein hota hai. It's always double. It's in pair, never in chain. And around each pair, there is a capsule. Not around each organism. You can see the diagram. You can see the beautiful diagram. Around each pair, there is a capsule. Around each pair, there is a capsule. So this is known as Diplococcus. Pneumonia is known as Diplococcus. You can get an image-based question. Pneumonia is known as Diplococcus. पहली खास बात pneumonia के बारे में. Now tell me tell me its culture. इसके culture में if you grow it on blood agar, you will get alpha hemolysis. Of course, it's alpha hemolytic. You will get alpha hemolysis. There is no important point in that. But after some time, can you see the colonies? There is a hole in the colony. There is a depression in the colony. There is a dimple. There is a dimple in the colony. Can you see the colony have a hole? Can you compare this colony? Have you ever played carom? कैरम खेला है कभी? Have you seen carom coin? कैरम की गोटी देखा है कभी? गोटी, carom coin कहते हैं इसको. I still play with my kid. Listen, it is having a depression at the center. And around the depression, there are concentric rings. Can you see the concentric rings? So here also we have a central depression, and around the depression, there is concentric rings. So we compare the colonies with carom coin appearance. So in pneumonia on blood agar, there is typical carom coin appearance, also known as Drotsman appearance. Now you get a simple one-liner question or an image-based question. Pneumonia. The first thing you have to learn, it's a Diplococcus. It occurs in pairs. It is having a capsule around it. The second thing you have to learn is having a depression, a central hole, a dimple at the center, which is known as carom coin or Drotsman appearance. Say yes. You get a question on that. Please learn. And do you all have bank account? Of course, we all do have bank account in some or other bank. In which bank you have bank account? I'm having a mnemonic. Pneumonia have bank account in which bank? So pneumonia have a bank account in Bank of India. My mnemonic is BOI, Bank of India. BOI. So my mnemonic is Bank of India. BOI. Okay. I'm teaching you mnemonic. So I always remember this mnemonic and I never forget. Pneumonia have a bank account in Bank of India. You will say, ma'am, what is this Bank of India? Let me tell you the full form. B stand for bile solubility. I will explain. It is only bacteria which is bile soluble in this world. No other bacteria is bile soluble. Okay. O stand for optochin sensitivity. Only bacteria which is afraid of optochin. If you put optochin, it will die. No other bacteria get afraid of optochin. Okay. And number 3, it is inulin fermentation. It is the only bacteria which ferment a sugar known as inulin. No other bacteria ferment inulin. So these are the 3 unique properties of pneumonia. Hannah, can you see blood agar? This is blood agar. See everyone. These are the colonies, beautiful colonies. Hannah, you can see colonies, circular, convex. Where are the colonies in this portion? I have put few drops of coil and the colonies disappear. In this portion, the colonies suddenly disappear because the colonies are bile soluble. So you can take a agar plate. The colonies are there, blood agar, put bile. The colonies disappear. So it is the bacteria which is bile soluble. It is bile soluble. Please learn that. Please learn that. Okay. It is a bacteria which is optochin sensitive. You see, this is blood agar and I have put a filter paper. This is a circular filter paper at the center, which is dipped in optochin and try to grow the lawn culture. I can see the yellow colonies. The yellow colonies of the pneumonia. Pneumonia is not coming closer to the optochin. No, no, no. If it comes closer to the optochin, optochin will kill it. So I'm getting a zone of inhibition. So it is known as optochin sensitivity. Okay. Optochin sensitivity. Okay. And inulin is a sugar. It's not insulin, people. Students read it insulin. Come on. It's not insulin. It's inulin. Inulin is a sugar like glucose, fructose, galactose. You know, it's a sugar. So it's a bacteria. It ferment a unique sugar, inulin. No other bacteria ferment it. So please learn pneumonia. Pneumonia have a bank account in Bank of India. Learn BOI. So say, ma'am, it's bile soluble. Yes, you know the meaning. The colonies are soluble in bile. Optochin sensitive. If you put optochin, the colonies will die. And inulin fermentation. It ferment inulin. How many of you got it? How many of you got it? Say yes. Micro is not at all difficult, people. The only thing, the approach is lacking. If you understand the approach of the micro, it's a super simple subject. Super. Let me commit. It's a super simple. I will make micro a fun for you. Okay, a cakewalk for you. Believe me, trust me. Just give me few hours. Micro will be a cakewalk for you. Okay, take my words. Yes. So these are the 3 unique properties. Tell me the diseases caused by pneumonia. Of course, I'm teaching you streptococcus pneumonia. You will say, ma'am, obviously, common sense. Pneumonia causes pneumonia. Hana, even a KG student tell me pneumonia causes pneumonia. But pneumonia causes meningitis also. Learn that. So pneumonia causes pneumonia, both type of pneumonia, lobar and lobular. You can see lobar and bronchopneumonia. Okay. And it causes meningitis. Learn the 2 diseases, pneumonia and meningitis. Pneumonia, meningitis. We are done with pneumonia. Coming on the next. I have to teach you 5 now. People, 5 padhane hai. 1 is done. 4 more to go. 1 is done. So we are done with pneumonia. In the alpha, I have to teach you 2. In the beta, I have to teach you 2. And in gamma, I have to teach you 1. So total 5. First alpha is done. Pneumonia is done. You know its unique property. You know its diseases. Now tell me the unique property and diseases of viridians. Viridians. It is also alpha hemolytic. What is unique in that? Okay. Very easy. Very easy. Listen. Pneumonia is Bank of India positive. B positive, O positive, I positive. The unique property of viridians, it's Bank of India negative. B negative, O negative, I negative. I mean to say, if I am getting a gram positive cocci, okay, please listen. If I'm having a gram positive cocci, it can be staph, it can be strep. Now I say it's catalase negative. So ma'am, it's strep, it's not staph. Okay, so a gram positive cocci, which is catalase negative and it's alpha hemolytic. So I'm having only 2 options. Hana, I'm having only 2 options. It can be Streptococcus pneumoniae or it can be Streptococcus viridians. What next I do? What next I do? So I'm having a gram positive cocci, which is catalase negative and alpha hemolytic. So this is the approach. By gram positive cocci पढ़ के मुझे लगता है स्टेफ भी हो सकता है, स्ट्रेप भी हो सकता है, मुझे नहीं पता. लेकिन catalase negative है. यदि catalase negative है, तो it has to be strep. Strep नहीं हो सकता, है ना? और strep are of 3 type, alpha, beta, gamma. If you say alpha, so alpha में only 2 options are there. They are in front of you, pneumonia and viridians. So the next test I apply is Bank of India, BOI. If all 3 are positive, it's pneumonia. If all 3 are negative, it's viridians. खत्म हो गई बात. देखो, all 3 are positive, it's pneumonia. All 3 are negative, it's viridian. What do you mean by positive and negative? This one is bile soluble, this one is bile insoluble. This one is optochin sensitive. This one is optochin resistant. Hannah, this is fermenting inulin. This do not ferment inulin. Say yes. Tell me the 2 diseases caused by this. I told you 2 diseases. What are the 2 organs? Say, ma'am, lungs, that is pneumonia in the lungs, and brain में meningitis. So pneumonia and meningitis. Learn the organ, lungs and brain I try to draw. है ना? So tell me the 2 diseases caused by viridians. Viridians की 2 diseases बता दो. Tell me the 2 organs. It causes dental caries, number 1. I will draw the teeth for you. It will cause the dental caries. I will show you the diagram. And it causes endocarditis, prosthetic wall endocarditis, early onset prosthetic wall endocarditis. So this is how I learn. This is how, Hannah. If I'm having an alpha hemolytic streptococcus, things are very simple. Apply Bank of India. Bank of India positive, it's pneumonia. Bank of India negative, it's viridians. Hannah. Pneumonia causes pneumonia and meningitis. Viridians causes dental caries and endocarditis. The organs are different. The diseases are different. Okay, say yes if you got it. So this is the thing. So viridians, I'm teaching you viridians. Say viridians, Bank of India, all 3 are negative. It causes 2 diseases, dental caries and endocarditis. How many of you got it? How many of you got it? We get a typical question. There is a person having a dental caries, going to a dentist. The dentist is doing the tooth extraction. After that, the patient has having valvular involvement and murmurs. So typically, the dental caries is caused by viridians, while dental extraction, the organism is going inside and now involving the heart and causing the murmurs and vegetations over the heart. Valvular involvement. How many of you got it? People respond, Hannah, write down. Give me a gesture that you got it. Give me a thumbs up. Write down something that you got it. You're getting the approach of bacteriology. So we are done with the 2 alpha. You know pneumonia, Bank of India positive, and the 2 diseases caused by that. You know viridians, Bank of India negative, and the 2 diseases caused by it. Let's come on beta hemolytic. In beta hemolytic also, I want to teach you 2. I want to teach you 2. Which 2? Group A and Group B. Although beta are 20, but I will teach you only 2. Group A is known as pyogens. Say yes. Group A is pyogens. Tell me the unique properties of pyogens and the diseases. Okay. The unique property, it is PYR positive. Okay. PYR is a unique test. It is positive. It is PYR positive. And it is bacitracin sensitive. This one is bacitracin sensitive. Now tell me, I told you novobacin. Till now I told you 3 chemical. Let me see. Who is attending my lecture from the beginning? You tell me. Novobacin differentiate what and what? Who is novobacin sensitive and who is novobacin resistant? Okay. Tell me, optochin differentiate what and what? Who's optochin sensitive? Who's optochin resistant? And now I'm telling you bacitracin. It differentiate what and what? Who's bacitracin sensitive and who's bacitracin resistant? Okay. So this is all step and step. You get the clues. You get the clues based on that. It's very simple. Novobacin differentiates Staphylococcus. It differentiates the main, the 2 side heroes, Staph epidermidis and Staph saprophyticus. Epidermidis is sensitive and saprophyticus is resistant. Hana, Staph saprophyticus. This one is saprophyticus is strong. It's resistant. Hana, optochin differentiate the 2 alpha hemolytic, the alpha hemolytic streptococcus. So streptococcus pneumoniae is sensitive and streptococcus viridians is resistant. This is BOI positive, this is BOI negative, BOI ka O hai ye. How many of you got it? So differentiate the 2 alpha hemolytic streptococcus. And now I am telling you bacitracin. Bacitracin separate group A. There are total 20 groups now. What are the 20 groups in beta hemolytic? A to B. So it's separate group A from B to B. From B to B, remaining all 19 groups. Total 20 types, है ना? Lancefield classification. So A is unique. It is bacitracin sensitive. वो बड़ा डरपोक है. Remaining all are resistant. So group A, streptococcus from remaining group B to B. How many of you got it, people? This is the approach-based microbiology. You get the clues in the question. You get the clues. अब कोई भी 6 में से clue आ गया. You can recognize they are talking about which bacteria. है ना? In the options, you can easily go. ठीक है ना? So it is bacitracin sensitive. Bacitracin sensitive. You can see the colonies are not coming closer to the bacitracin. Okay, so these are the 2 unique properties. What diseases it causes? I'm talking about Streptococcus pyogenes. Group A streptococcus. What diseases it causes? It causes respiratory, skin, and others. Suppurative and non-suppurative. Non-suppurative, okay, it causes rheumatic fever and PSGN. But suppurative, it causes respiratory, skin, others. In the respiratory, it causes sore throat. Have a look. Have a look. You can see the pus in the tonsils and you can see the patiki. So this is sore throat. Okay, respiratory. In the skin, there are many, but 2 are important. What 2 are important in the skin? You can see impetigo and erysipelas. What is impetigo and erysipelas? You can see in impetigo, it's crusting. The lesion is like the crust. It's crusting. It's looking like honeycombing. Madhumakhi ka chatta. It's looking like honeycombing. And in erysipelas, there is pus in lymphatics. There is pus in lymphatics. The lymphatics have the pulse. Pus. Have you seen an orange fruit? Santra dekha hai kabhi? Orange. Santra. Have you seen the orange? In the orange, the chilka of the orange, the skin of the orange is hard, granular, and orange. So the skin is looking like hard, granular, and orange. So it is known as erysipelas. It is known as pedio orange appearance. I'm really sorry. Give me a minute. I'm sorry, we will continue. So this is pedio orange. So I want you to learn the two appearance. I want you to learn pedio orange is erysipelas, and I want you to learn that honeycombing is impetigo. So that is the two skin diseases I want to tell you. And others, Hannah, it causes vasodilatation overall in the body. If it causes vasodilatation of all the cutaneous blood vessels, it leads to scarlet fever. Can you see scarlet fever? It is vasodilatation of the cutaneous blood vessels throughout the body. Mainly, vasodilatation occurs in the tongue blood vessels, and it leads to strawberry tongue. It leads to strawberry tongue. So what are the diseases? In the respiratory, it causes sore throat. See the image. Okay, in the skin, it causes two important. Impetigo, that is honeycombing, and erysipelas. See the image. Okay, and in the others, okay, in the others, it is causing scarlet fever and strawberry tongue. You can see strawberry tongue and this. So let's move further. Let me come on the next one. So we are done with the 2 alpha. Okay, both the alpha are done. We are done with one of the beta. Let me tell you the other beta. Can I tell you the other beta? Let me tell you the other beta. The other beta is group B, beta hemolytic. That is Streptococcus agalacti. Let me tell you the Streptococcus agalacti. The two unique properties of Streptococcus agalacti. It's hippurate positive. No other bacteria is hippurate positive. And it's CAM positive. No other bacteria is CAM positive. So please learn the two unique properties of agalacti. It is hippurate positive and CAM positive. And only disease, it is causing only one disease, that too neonate. People, please give me 1 minute. I'm really sorry. I guess it will be settled. Give me 1 minute. I guess I'm good. Okay, let's see. Let's continue. So Streptococcus agalacti, I was teaching you the unique properties of all the Streptococcus along with the diseases they are causing. Okay. So Streptococcus agalacti is group B. So the two unique properties, it is hippurate positive. You have to learn the unique properties hippurate and CAM. No other bacteria is hippurate positive. CAM positive, other bacteria are there. But in the Streptococcus, it is the only Streptococcus which is CAM positive. It causes only one disease, that too in neonate. So I'm having the cough. I don't know why. Let's try. Otherwise, we will take a break of 5 minutes. Okay, let's try. Let's try once. Okay, if I'm having the issue, we'll take a break. Okay, let me try. So here the neonatal, the typical question start, there is a newborn having seizures. Typical question hoga. Or less than 28-day baby, 7-day baby, 10-day baby, a newborn having the seizures, having high-grade fever. So we are talking about neonatal sepsis and meningitis, typical question. That is agalacti. Okay, last is gamma. We have only one bacteria to be discussed in gamma. That is Enterococcus. Again, it is having two unique properties. What are the two unique properties here we are having? You can see it is having a special test. The name of the test is bile esculin test. Please mind, it is not bile solubility test. No. Bile soluble is Streptococcus pneumoniae. This one is bile esculin test. Bile esculin test positive. Okay, just learn the names. Okay, you will get bile esculin test positive bacteria. Okay, only one bacteria. And it can grow in extreme as 6.5% NaCl, as extreme as 40% bile, as extreme as 60 degree for 30 minutes. And it causes nosocomial infection, hospital acquired. So we are done. We are done. This is the approach we have learned. Everyone here, we are revising the master chart. Everyone come back. Please listen, everyone. So we have completed two bacteria here. What are the two bacteria we have completed? Gram-positive cocci. Step and step. Let me tell you the approach now. Okay. So the first test I will apply for a gram-positive cocci. Okay. The first test I will apply for gram-positive cocci is catalase. Catalase positive is Staphylococcus. Catalase negative is Streptococcus. Start from the beginning. Let's come on Staphylococcus on this page. Streptococcus I will take on next page. How many type of Staphylococcus are there? What is the next test we will do? So next test we will do is coagulase. Based on coagulase, we differentiate the main hero from the side hero. The main hero here is Staph aureus. and the side hero, which are coagulase negative, are known as cones. How to differentiate the two cones among themselves? How to differentiate the two cones among themselves? So the next test we apply is novobiosyn. Novobiosyn sensitive or resistant? Novobiosyn sensitive is staph epidermidis and resistant is saprophyticus. See, have a look. This is the approach. And here I taught you only one thing. Staph aureus, the 4 toxin and the 4 diseases. You know the 4 toxin and the 4 diseases, I guess. Cytolytic toxin, enterotoxin, toxic shock syndrome toxin, and epidermolytic toxin, also known as exfoliative toxin. And the 4 diseases it is causing: cytolytic toxin causes pus, enterotoxin causes food poisoning, toxic shock syndrome causes toxic shock syndrome in a menstruating female, enters via tampons, and epidermolytic toxin causes SSSS Nicolsi sign. We have seen the images, we have seen the details. Now coming on Streptococcus. Okay, let's come on Streptococcus. Okay, let me classify it further. How we classify Streptococcus? We classify based on hemolysis: alpha, beta, and gamma. We have 3 types of Streptococcus. In alpha, we have only 2 options: Streptococcus pneumoniae and Streptococcus viridans. In beta, we have 20, but in our syllabus, only 2 are there: Group A and Group B. Group A is Streptococcus pyogen, and Group B is Streptococcus agalacti. Streptococcus agalacti, learn the name. That is Group B. Okay. And gamma mein, it's Enterococcus. I want you to tell me the unique properties of all 5. Unique properties, all 5. Who will tell me? Huh? Streptococcus pneumoniae, the 3 unique properties. Say, ma'am, Bank of India positive. It is BOI, positive, positive, positive. Bile soluble, okay. Optochin sensitive, okay. And inulin ferment. And the 4th thing, it gives a carom coin appearance on blood agar, also known as Drotzman appearance. Hana? All the 4 things are negative here. No carom coin, no bile solubility, optochin resistant, and it is inulin non-fermenting. So all the things are negative in viridians. Okay, so that is the only unique property. Everything is negative here. Okay, about the pyogens, the 2 unique properties: PYR positive and bacitracin sensitive. Please learn the 2 unique properties here. Hana, agalacti also have the 2 unique properties. It's hippurate and camp. Never forget. It's hippurate positive. Okay, and it's camp. Let me show you. Hippurate positive and camp positive. So learn the 2 things. It's hippurate and camp. So learn that agalacti. And Enterococcus also have 2 unique properties. It can grow in extremes. You know what extremes? As I has what? And it is bile esculin test positive. Bile esculin. It's not bile solubility. Bile soluble is pneumonia, but this one is bile esculin. Bile soluble is this one. I hope you got it. Everyone give me a thumbs up if you got it. Say it. Now tell me the diseases caused by them. That's it. Tell me the diseases. Khatam. The unique properties with the diseases. Question is done. Khatam. Aur kuch nahi karna. है ना? The unique properties with the diseases. Big approach based question. सारे बन जाएंगे. कोई भी कर लो. Take my words. ठीक है? Pneumonia में. Tell me the 2 diseases. The 2 organs, the 2 diseases. Say, ma'am, lung, brain. Lung, brain. That is pneumonia in the lung. Brain में meningitis. ठीक है? Viridians में tell me the 2 organs with the 2 diseases. Teeth and heart. Teeth and heart. So dental caries and the heart. Heart में endocarditis. Dental caries and endocarditis. ठीक है? Pyogens में tell me 3 diseases. हाँ? Respiratory. Respiratory में sore throat. है ना? Number 1. ये पढ़ के ही मुझे खांसी चल गई थी. I don't know why. है ना? So respiratory में sore throat. ठीक है? The second was skin. Skin में impetigo and erysipelas. ठीक है? Impetigo, erysipelas. And others में vasodilatation. Because of vasodilatation, scarlet fever, the cutaneous vasodilatation, and strawberry tongue. Because of vasodilatation of the tongue. How many of you got it? Got it? Huh? Got it? Huh? And so that is the diseases caused by Streptococcus pyogens. Agalacti में only one disease, neonatal meningitis sepsis. Typical question start होगा. The newborn is having high grade fever and seizures. Seizures indicate meningitis. है ना? Meningitis in a newborn, neonate. है ना? Less than 28-day baby. Say yes. And the last one is Enterococcus. It causes nosocomial infection. See, this is the unique properties of all of them with the diseases, all of them. Please learn it. This is the master chart I call. So this is for Streptococcus. This is for Staphylococcus. This is the combination of the 2 I have already provided you in the notes. Please learn it. You are going to get one approach-based question from this. Everyone give me a thumbs up. We are done with the 2 bacteria, people. You want one question? Kaise question aega? The question will be like this. Let's try. Let's try once. Hello? Only one. So tell me a gram-positive bacteria. Hello? Step by step we will go. Gram-positive. Say, ma'am, gram-positive can be staph, can be strep. But it is saying it is catalase negative. So catalase negative is only strep. It is not staph. So by reading this word in the question, I will remove this option. It cannot be Staph. It cannot be Staphylococcus because it is catalase negative. Come on, it's catalase negative. Now, catalase negative, it is Streptococcus. There are three types of Streptococcus, alpha, beta, gamma. So they are saying as alpha. Now in alpha, I am having only two options. Which two alpha? Pneumonia and viridians. So it can be pneumonia, it can be viridians. I cannot say, but it cannot eGalacti because it is beta hemolytic. It is beta hemolytic. So I have removed one more option. So I'm left with two. Now I'm left with two, the two alpha hemolytic Streptococcus. It can be pneumonia, it can be viridians. I need more clues, more clues. So two more clues are given to me. It is optogene resistant and it involves the heart. It causes endocarditis. Both these properties fit in viridians. Viridians causes dental caries and endocarditis. And it is Bank of India negative. Bank of India negative. It is optogene resistant. If I say optogene sensitive and it causes pneumonia, if I change the two words, my answer will become pneumonia. How many of you got it? Say yes. How many of you got it? Can we go ahead? Huh? Appreciate the efforts behind this. Okay, so this is approach-based microbiology. Can we go ahead? Can we go ahead? So these are the two bacteria we have completed quickly. Step, these were the biggest bacteria, I must say. No, the rest of them are very small. Let's start with the Neisseria, the next bacteria which I want to teach you the details. There are two Neisseria I want to teach you here. Neisseria meningitis and Neisseria gonorrhoeae. Everyone give me a thumbs up. Anna, we are learning microbiology like anything. So let's start the two Neisseria. Neisseria meningitis, Neisseria gonorrhoeae. Listen, both of them are Diplococcus. They occur in pairs like pneumonia. So this also occurs in pairs, but the shape is half moon shape. And this also occurs in pairs, but the shape is kidney or bean shape. Say, this is half moon shape, this is kidney or bean shape. So meningitis occurs in half moon shape, gonorrhea is kidney or bean shape. Both of them are in pairs. Okay, meningitis is capsulated. The capsule is present. Okay, the capsule is present. But gonorrhea, no capsule is present. Here the virulence factor is pili. Here pili or fimbriae is present. So please learn. So here capsule is present, here capsule is absent and pili. So the diagram itself depicted. Both of them are catalase positive. Write down. Both of them are oxidase positive. Okay, ji, है ना? Both of them are catalase positive. Both of them are oxidase positive. Both of them ferment glucose. Till now, I cannot differentiate them. So how to differentiate them? The main thing to differentiate them is maltose, not glucose. It's maltose. Maltose is fermented by meningitis, but maltose is not fermented by gonorrhea. So how to learn that? M for M. I'm having a mnemonic also. The mnemonic is M for M. Meningitis, ferment maltose. M for M. Learn the mnemonic. Learn the mnemonic. M for M. Meningitis, ferment maltose. How many of you got it? So you get a question on maltose. It is the maltose who is going to differentiate the two Neisseria, meningitis and gonorrhea. Maltose. Please learn that. Got it? Got it? Okay, so that is the maltose. And the diseases caused by them is absolutely different. Meningitis causes meningitis and gonorrhea causes an STD, that is gonorrhea. So let me tell you the diseases caused by them. So we are done with these two also. You can see this is Neisseria meningitis. Diplococcus, arranged in pairs. This is half moon shaped. This is kidney shaped. Here capsule is present. Here no capsule, pili is present. Here pili is present. Both of them are catalase positive, oxidase positive. Both of them are catalase and oxidase positive. Glucose is fermented by both of them. Okay, but it is the maltose which makes the difference. Maltose, M for M. Never forget. Okay, never forget. Now the diseases. Meningitis causes meningitis. Number one, it causes meningitis. Number one, it causes rashes also. From the meninges of the brain and from the rashes, it goes in the blood and causes septicemia. The third thing is septicemia. So meningitis, rashes, then it goes in the blood, causes septicemia and multiple organ involvement. It is known as Waterhouse-Friderichsen syndrome. Waterhouse-Friderichsen syndrome is multiple organ failure. Patient goes in DIC, shock and dies. The severe form of meningitis, meningococcal infection, the severe form. So learn, सबसे पहले meningitis, rashes, then it goes in blood, causes septicemia and then multiple organ failure. That is Waterhouse-Friderichsen syndrome. So Waterhouse-Friderichsen syndrome is caused by meningitis. Neisseria meningitis, you have to learn that. Got it? Got it? Now what about gonorrhea? See, ma'am, gonorrhea causes only one disease. The name of the disease is gonorrhea. Gonorrhea causes gonorrhea. It's an STD, sexually transmitted disease. Of course, everyone knows it's STD. What are the symptoms in male and female? What are the symptoms in man? What are the symptoms in women? What are the symptoms in girls? In girls, it is different from women. And what are the symptoms in infant? Tell me the symptoms. Who will tell me? In man, the first symptom is urethritis. Urethritis. It typically starts with urethritis. After that, multiple other organs are involved, prostate. Finally, around the penis of the male, multiple small pus discharging sinuses are there. The pus is coming out. It is known as water king perineum. Hana, the last stage, the complications. Okay. In women, it starts with cervicitis. Then fallopian tube, PID, multiple other organs are involved. Finally, multiple fibrotic bands are formed in the peritoneum. The last complication is known as Fitzhugh-Curtis syndrome. Hana, but in girls, before marriage, it involves vagina, not cervix, vulvovaginitis. And in infants, it causes ophthalmia neonatal. It causes ophthalmia neonatal. So tell me the presentation of gonorrhea. What is the presentation of gonorrhea in man? What is the presentation of gonorrhea in women? What is the presentation of gonorrhea in girls, prepubertal girls? And what is the presentation of gonorrhea in newborn? Who will tell me the presentation? In man, it starts with urethritis and finally leads to water king perineum. In females, it starts with cervicitis and finally leads to Fitzhugh-Curtis syndrome. In girls, it's vulvovaginitis, not cervicitis like adult female because of change in vaginal pH. And in newborn, it's ophthalmia neonatorum. How many of you got it? How many of you got it? Do you have any doubt? Anyone is asking any doubt? Say yes. If you have any doubt, please write down in the chat box. Okay, so got it. Now let me ask you here. In these three population, it enters via sexual intercourse from the partner. Hana, so it remains in the urethra of the male and cervix or vagina of the female, depending the female partner is a girl or an adult woman. Hana, so it is transmitting from one person to another via sexual intercourse. But newborn don't do sex. So how does it enter the newborn? And how it is causing ophthalmia neonatal in the newborn? Can you see in the newborn? How does it causes? What is the root? Does anyone tell me? What is the route of entry of the organism in the newborn, in the eyes of the newborn, how it is entering? It is not sexual intercourse. How does it enter the newborn? I'm asking. Anyone, please answer in the chat box. Listen, this is the pregnant lady, uterus. This is the vagina. And you can see this is the newborn. This is the newborn. These are the eyes of the newborn. During pregnancy, she got gonorrhea. And she is not treated for that. So during gonorrhea, she is having cervicitis. And this is the organism present in the cervix of this pregnant lady. You can see the lady is pregnant. She's having cervicitis during pregnancy. And she's not treated because she's a periphery living and she has not attended even a single antenatal visit during the entire pregnancy. And directly she is doing the home delivery. Okay. And now it is the vaginal delivery. Via vaginal route, the newborn is coming out of the vagina of the mother. So when the newborn coming out of the vagina of the mother, the organism enters in the eyes and causing ophthalmia neonatal. So this route is known as infected birth canal. Absolutely right. Question, absolutely right. It's infected birth canal. So let me ask you one more question. Will it occur in cesarean section? In cesarean section, we will take the newborn out from here. We will not, the newborn will not cross the vagina. No, it will not occur in cesarean section. It will occur only in vaginal delivery. Okay, so ophthalmia neonatal can occur only in vaginal delivery if the birth canal of the mother is infected at the time of the delivery, the vaginal delivery. So we are done with the Neisseria, we are done with staph, strap, we are done with the Neisseria. Now let me come on the gram-positive bacilli. I will teach you few important bacteria from here and then we will move on virology. So let me come on the bacilli. Anna, Bacillus anthrax. I want to teach you here. Ultra important bacteria. I will teach you three bacteria from here. Bacillus anthrax, Clostridium and diphtheria. The three ultra important. You frequently get questions on that. Let me come on Bacillus anthrax. Okay, so what is Bacillus anthrax? So Bacillus anthrax is capsulated. Have I taught you the 9 capsulated bacteria in my last, when I started the lecture? What is the mnemonic of 9 capsulated bacteria? Let me open the chat. Just a second. My chat is gone. Just a second. Okay. I can see it. Listen, only 9 bacteria are capsulated. What are those? The mnemonic is yes. Very killer bacteria have pretty nice capsule. If you know, I have told you this mnemonic. So I told you all the capsules are made up of polysaccharide except one. What is the exception I told you? At the beginning of the lecture only I told you. The exception is Bacillus anthrax, which I'm teaching you right now. Here the capsule is made up of polypeptide. That is polyglutamate. Have I taught you? Anna, if you have missed it, please learn it now. So here it is a capsulated bacteria, but the unique thing is that the capsule is polypeptide in nature. It's polyglutamate. It's not polysaccharide like other 8. Please learn. And it's a spore-forming bacteria. Have I taught you the mnemonic of spore-forming bacteria? BSc chemistry. Yes, so it is one of the B. It is the B of the BSc chemistry. It is a spore-forming bacteria. And the unique thing is that it is arranged one behind the other like the bogies of the train. Can you see? It is arranged one behind the other. Ek ke piche ek. Like the bogies of a train. It is known as bamboo stick appearance. Can you see the bamboo? It is like the square. This is the bacteria inside which the spore is present at the center. So the bacteria are like this. So that they are like boxes. one behind the other, like the bogies of a train, inside which the capsule is present. So it is a capsulated bacteria, and the complete bogie, the complete train is surrounded by a capsule. So it is capsulated. The capsule is made up of polypeptide, polyglutamate, and it is a spore-forming bacteria which is coming in BSc chemistry. Say yes if you got it. Say yes if you got it. Thank you so much for your compliments. Thank you, everyone. Hannah, I'm sorry I am not very frequently replying to your chat, but you know the time is limited. That's why I have to cover as much as I can. Okay, but thanks a lot for your compliments. And if you have any doubt, please don't hesitate to write down in the chat box. So Bacillus anthrax, we have seen the morphology. Learn the bamboo stick appearance. Now let me tell you the 5 culture media of the Bacillus anthrax. Can I tell you the 5 culture media of the Bacillus anthrax? Yes, I will tell you the 5 culture media. Listen, I will tell you nutrient agar, है ना, gelatin swab, solid media containing penicillin, methylene blue, and selective media. Believe me, all 5 have previous year questions. They are asked in PYQs. Believe or don't believe, you can check if you don't believe. So all 5 have previous year questions. You have to concentrate. Listen, I'm teaching you what? The bacteria. The name of the bacteria is Bacillus anthrax. Okay. So on nutrient agar, I told you it formed bamboos, na? On nutrient agar, it is known as Medusa head appearance. Say, ma'am, who's Medusa? Medusa is a girl who's having a curly hair. Now you can see the name of this girl is Medusa. So can you see the colonies on nutrient agar? They are looking like Medusa head? Yes, the colonies are looking like this because the bamboos, they interlock with each other. I repeat, the bamboos interlock with each other. And that is typically Medusa head appearance on nutrient agar. Learn it. Medusa head appearance on nutrient agar. Got it? Got it? Now, gelatin swab. Can you see this is gelatin swab? So this is a test tube. It contains the gelatin. If I put 1 drop of Bacillus anthrax over here, it will start liquefaction, the gelatin. But the liquefaction, if you can see, the shape of the liquefaction is like this. So it is looking like an inverted fur appearance. Inverted triangle, you can say. Inverted Christmas tree. Inverted fur. Why? Why it is inverted fur? The reason is also asked in one of the exam. Why it is inverted fur? You know, Bacillus anthrax I am teaching you. It is one of the obligate aerobe. Can you tell me the mnemonic of obligate aerobe? In the morning only I told you. Huh? Today when I started the session, I mean, the mnemonic is nesty pest must breathe. These are for obligate aerobe. They grow only in presence of oxygen. If you don't give them oxygen, they will die. So Bacillus anthrax is one of them. So maximum oxygen is at the surface. So maximum liquefaction at the surface. As you go deeper, the oxygen reduce. Liquefaction reduce. This is the reason, and that is asked in your exam. Say yes, people, say yes. So this is inverted for appearance. Got my point? Huh? Now see, on the solid media containing penicillin, penicillin kill all other bacteria except Bacillus anthrax. So Bacillus anthrax is forming a shiny, white color, shiny colonies. It is looking motiyon ka haar. It is known as string of pearl appearance. What it is known as? String of pearl. Okay. Now this is Bacillus anthrax. It is a specimen containing Bacillus anthrax. And I'm mixing methylene blue in that. Methylene blue dye in that. I'm mixing the two. So what does methylene blue will do? Bacillus anthrax have the capsule now. The methylene blue will separate the capsule of Bacillus anthrax. It will separate the capsule. Now make a smear. What do you see in the smear? The capsule is separate, the bacteria is separate. Can you see the bamboos? Appreciate the bamboos here. Bamboo, one behind the other. These all are bacteria. The bamboos you can see. Where is the capsule? Where is the capsule? The capsule got separated and forming the degenerated amorphous clump. This is known as Mac-Faridian reaction. What it is known as? Mac-Faridian reaction. So what is Mac-Faridian reaction? In Mac-Faridian reaction, we mix the two things. Bacillus anthrax with polychromatic methylene blue. Methylene blue will separate the capsule from the bacteria and it will be shown as amorphous clumps. You can get this image in your exam. They will ask you to label. The bamboos are Bacillus anthrax. The clumps are degenerated capsule. And the name of the reaction is Mac-Faridian reaction. How many of you got it? Huh? Got it. And the selective media is PLET. The selective media you have to learn for all bacteria is PLET. Say the answer. I'm teaching you Bacillus anthrax. So in Bacillus anthrax, you tell me what happens on nutrient agar? What happens on nutrient agar? Remember on nutrient agar, it's Medusa head appearance. Medusa head appearance, the curly hair. On gelatin swab, it's inverted fur appearance because it's an obligate arrow. Maximum liquefaction at the top. On solid media containing penicillin, it's string of pearls. मोतियों का हार, है ना? On polychromatic methylene blue, it gives Mac-Faridian reaction in which the capsule will separate and it will form amorphous clumps. Selective media is PLET. Give me a thumbs up, everyone. Got it? Got it? Say yes if you got it. Coming on the next bacteria. The next bacteria is diphtheria. We are done with Bacillus anthrax, now diphtheria. Diphtheria is Clostridium diphtheria. We use Albert stain. I taught you when I started the lecture, the staining. I taught you Albert stain and stain only 5 bacteria. Diphtheria is one of them. Okay. This bacteria, the unique feature of Corynebacterium diphtheria is that it is angulated. Can you see the angulated? It is the letter V or L. It's angulated. Why it is angulated? Why it is angulated? Now, this is a bacteria. Bacteria divide by binary fission into 2 daughter bacilli. The daughter bacilli do not separate from each other. That's why it's angulated. Hannah, now have you seen the Chinese language? I don't know Chinese, but have you seen written somewhere on some toys or Chinese item? The Chinese is written like this. It's like this. Hannah, it's something like this. So it is angulated. So looking at this near, I think it's a Chinese language written. So can I call it Chinese letter arrangement or cuneiform arrangement? You get question on that. Chinese letter arrangement or cuneiform arrangement because of the angulated appearance of the bacteria. It is seen in Corynebacterium diphtheria. How many of you got it? Corynebacterium diphtheria. The Chinese letter or cuneiform arrangement. It is the angulated appearance of the bacteria. Yes. MHC Garden Agra. Absolutely right, Jay Devesh. So MHC Garden Agra ka C jo hai, that is Corynebacterium diphtheria. So MHC Garden Agra are the 5 bacteria which is having Albert positive, the metachromatic granules. So this is Corynebacterium diphtheria. Let me tell you how does diphtheria occur. Let me tell you. Diphtheria kaise hota hai? The diphtheria enter via respiratory route. See, it is entering via respiratory route. Once it enters via respiratory route, it involves the tonsils. It forms a pseudomembrane over the tonsils. It forms a pseudomembrane over the tonsils. Got my point? Anna? After that, this is the bacteria. It will form pseudomembrane, the gray color. It looks like membrane, but it's not a real membrane. If you try to separate, it will bleed. It is the bacteria. Now, mind my words, the bacteria will form toxin. The toxin will go in the blood. The bacteria will not go in the blood. No, no, no. The toxin will go in the blood. After going in the blood, the toxin attack 3 organs. Number 1, heart. It causes myocarditis. Number 2, nerves. It causes neuritis. And number 3, adrenal gland. It causes adrenal hemorrhage. This disease is known as diphtheria. How many of you got it? So can I say the diphtheria is caused by the toxin, not the bacteria? Yes. Systemic diphtheria is caused by the toxin. So there is a statement, diphtheria is toxemia. Yes, it's right. Diphtheria is toxemia. Can I say diphtheria is bacteremia? No, it's wrong. Bacteria don't go in the blood. No, no, no. Bacteria send toxin in the blood. It's a question. How many of you got it? Bacteria send toxin in the blood. And this is how diphtheria occur. So this is how toxin act. This is the tonsil. I can show you. This is the pseudomembrane I'm talking about. This is the pseudomembrane. Okay. And because of the pseudomembrane formation, there is the swelling in the neck. It is known as bull's neck appearance. Bull's neck appearance. This one is known as bull's neck appearance. So this is diphtheria. Got it? Can we go ahead? Can we go ahead? Say yes. Okay. So let's go ahead. The next bacteria. The next bacteria is Clostridium. Ultra important. There are 4 types of Clostridium which are important in our syllabus. Clostridium perfringens, Clostridium tetani, Clostridium botulinum, and Clostridium difficile. These are the 4 important bacteria in our syllabus. Okay, you have to tell me the capsule, motility, and spores among them. I call perfringens as Gaddar. Hana, it is going against of its family. So all of them are non-capsulated, but perfringens is capsulated. See, you get question on exceptions. People learn. Perfringens is going against of its family. Perfringens सबसे अलग जा रहा है. All of them are non-capsulated. Perfringens is capsulated. है ना? All of them are motile. Perfringens is non-motile. सबके पास कैप्सूल नहीं है. Perfringens नहीं. मुझे तो चाहिए कैप्सूल. मैं तो अलग जाऊंगा. सबने बोला हम तो मोटाइल है, हमारे पास फ्लैजिला है ना? इसने बोला मुझे नहीं चाहिए, है ना? So इसके पास फ्लैजिला नहीं है. So it is non-motile. I have told you flagella की mnemonic में all Clostridia are motile except Perfringens. So Perfringens is an exception here also. Learn the other name of Perfringens. It is known as Welchii. So Welchii or Perfringens is one and the same thing if you don't know. Learn it. And in spore, there is no exception. They all form the spores. Spores में कोई exception नहीं है. So learn 2 exceptions, people. You get questions on the exceptions. Learn these 2 exceptions over here. Perfringens is exception from rest of the members at 2 places. And you get questions on that. इसको highlight करो और learn करो. Please learn the exceptions. Okay. Now, have I taught you obligate anaerobe? How many obligate anaerobe you know? Obligate anaerobe. Obligate anaerobe are the bacteria which grow in absence of oxygen. If you give them oxygen, they will die. So I told you the mnemonic is can't breathe air or ABC. Can't breathe air. C is Clostridium. So currently I'm teaching you Clostridium. Clostridium is the obligate anaerobe. So we grow it in RCM. What is RCM? Robertson cooked meat medium. This is RCM, Robertson cooked meat medium. Okay, what does it contain? It contains meat. Yes, ox heart ka meat. See, these are the meat ke pieces. These are the 2 meat pieces you can see at the bottom of the test tube. Can you see the bottom of the test tube? You can see the 2 meat pieces here. Hana, What does meat contain? Say, ma'am, meat contain carbohydrate also, protein also. Do you eat meat? If you're a non-vegetarian, you may be knowing the meat contains protein also, it contains carbs also. What do you eat in your diet? Some people like carbohydrate more, less protein. Some people like more protein, less carbohydrate. It is, choice of the person to person. In the same way, if you put a Clostridium here, 1 drop of Clostridium. Now there are certain Clostridium which eat only carbohydrate, which don't eat protein. I know these are known as saccharolytic. So if carbohydrate content is digested of this meat piece, but protein content is not digested, the meat piece become pink in color. So saccharolytic Clostridium convert the meat piece into pink color by degrading the carbohydrate content. Now, there are certain Clostridium which eat only protein. They don't like carb. They eat protein, protein, protein. So if the protein component is digested, not carbohydrate, the meat piece convert black in color. And it is known as proteolytic Clostridium. So Clostridiums are of two types. They can be saccharolytic, they can be proteolytic. The saccharolytic digest the carbohydrate, they convert the meat piece into pink color. And the proteolytic, they digest the protein and they convert the meat piece into black color. So looking at the color of the meat piece, you can decide whether the Clostridium is saccharolytic or proteolytic. Give me a thumbs up on this point. Got my point? So you have to learn which Clostridium is which based on the RCM. Okay, now let me tell you the important point of the 4 Clostridium and move further. Okay, so Clostridium perfringens. Let me tell you Clostridium perfringens. Clostridium perfringens causes gas gangrene. It's a gas producing bacteria. It causes gas gangrene. On blood agar, this is the colony. It shows alpha as well as beta hemolysis. It shows double hemolysis. The only bacteria which shows double hemolysis, alpha as well as beta. It is known as target or double hemolysis. That is perfringens. Hana, it converts meat pieces into pink color. That's its saccharolytic. Hana, on egg yolk media, it shows Nigler reaction. And it is reverse CAM positive. I told you one bacteria which is CAM positive, Streptococcus agalacti. Right now I taught you Streptococcus agalacti was CAM positive and hippurate positive. This one is reverse CAM positive. So these are the 4 unique features of Clostridium perfringens you have to learn. Perfringens की 4 खास बातें. On blood agar, you can see on blood agar, it shows double hemolysis, alpha followed by beta. You can see it's the target. Okay. On RCM, it forms the pink, meat pieces pink, saccharolytic. On egg yolk, it's Nigler positive and it shows reverse CAM. Please learn its reverse CAM. Hana? And it is a bacteria which is responsible for gas gangrene because it is a gas producing bacteria. Tetany, it causes a disease tetany. Hana? And botulinum, it causes the disease floppy baby syndrome. Let me tell you the two together. Listen. Please, everyone on the screen. Please, everyone concentrate. Okay, give me a minute. Let me open the chat. Oh, I can see it. Listen, everyone. Clostridium tetani form a toxin known as tetanospasm. How does it act in human body? And Clostridium botulinum also form a toxin which is known as botulinum toxin. How does it act in human body? Let me tell you the two toxins mechanism. Listen, the Clostridium tetani. There are 2 types of neurotransmitters in the physiology. You may have read it. And after my session, there is a physiology session. You may read there also. Okay. There are 2 types of neurotransmitters in human. What are the 2 types of neurotransmitters? Excitatory, inhibitory. The excitatory causes contraction and it is via acetylcholine. The inhibitory causes relaxation. It is via GABA and glycine. Listen, I can contract my muscle, I can relax my muscle because I'm having acetylcholine as well as GABA glycine. So there is a balance. The posture is a balance. I am standing in front of you. Some of my muscles are relaxed and some of my muscles are contracted. That's why I'm having a balanced posture in front of you. Say yes, Hannah. So we have excitatory and inhibitory, both are type of neurotransmitters. Now, if Clostridium tetani enters in any human, for example, Hannah, it releases a toxin tetanospasm. What does it do? It inhibits the inhibitory neuron. No inhibitory neurons, no relaxation, no GABA, no glycine. So there is unopposed contraction. Unopposed contraction leads to a disease known as tetany. Unopposed contraction leads to a disease known as tetany. See, the complete body goes in spasms, especially the back muscles. The back muscles goes in spasms like this. The back muscles goes in spasms. The posture is known as opisthotonous position. What is this posture known as? This posture. Now, this is the complete body going in spasm. Name the first muscle which goes in spasm. The first muscle which goes in spasm is this one. Masseter muscle. Can you see masseter? The masseter. It's like this. The person cannot do the relax like this. So it's unopposed contraction. It is known as lockjaw or trismus. Okay. It can occur in neonates also. And opisthotonous. This is tetany. Now, what about Clostridium botulinum? Again, come on the same diagram. Now, for example, Clostridium botulinum is entering in someone's body and it secretes the toxin botulinum toxin. It inhibits the excitatory neurons in contrast to tetany. है ना? No excitatory neuron, no acetylcholine, no contraction. So unopposed relaxation is there. Unopposed relaxation is there. And the name of the disease is floppy baby syndrome. The name of the disease is floppy baby syndrome. It is the opposite of tetany. See, the complete body of the baby is relaxing. There is no tone. Floppy baby syndrome. How many of you got it? Say yes. Please say yes if you got it. Yes. Yes, absolutely right, Anshul. Absolutely right. So it is inhibiting the GABA and glycine presynaptically. Absolutely right. Okay. And the last one is Clostridium difficile. Say yes. Interact, people. Come on. You are learning or not? Say yes. So the last one is so you learn here Clostridium perfringens, learn gas gangrene. Tetany, it inhibit GABA and glycine. GABA and glycine, that is inhibitory neuron. This one inhibit acetylcholine release. So this one causes tetany. This one causes floppy baby syndrome. Learn the mechanisms. And Clostridium difficile. Let me come on the last. You get frequent question on Clostridium difficile. See, this is a colon. This is a human colon. You can see this is a human colon. Inside the human colon, many bacteria are present, which are good bacteria. These are known as commensal. It is present in you, me. What good they are doing? Why they are good bacteria? What good they are doing? They're like guards. They inhibit the entry of harmful bacteria. They inhibit the entry of harmful bacteria. They are like guards. Now imagine this patient is coming to me having somewhere pus or some bacterial infection. What I will do? Simon, give antibiotic. Very simple. Give antibiotic. No, antibiotic don't have eyes that this is a good bacteria, this is a bad. I have to kill the bad one, not the good one. Antibiotic is a drug that kill all bacteria, whether good or bad. So antibiotic will kill the good bacteria also. All these commensals are gone. Now there is no one to inhibit the entry. The guard is gone. There is no one to inhibit the entry of harmful bacteria. And the most important harmful bacteria which will enter here is Clostridium difficile. Clostridium difficile will enter, and the toxin of the Clostridium difficile will cause the necrosis, produces a pseudomembrane there. It is known as pseudomembrane colitis. What disease it causes? Pseudomembrane colitis. Membrane in the tonsil, diphtheria. Membrane in the colon, Clostridium difficile. You get a typical question. There is a patient having blah, blah, blah infection. Every time the infection will be different. Is on prolonged course of antibiotic and now having diarrhea and abdominal pain. So patient have diarrhea and abdominal pain after prolonged course of any antibiotic. It's a typical case of Clostridium difficile. How many of you got it? So it's Clostridium difficile. Got it? Can we go ahead? Can we go ahead? Okay, so I guess we should stop bacteria and come on the viro, because I have to complete the viro, parasito, and myco also a little bit, the important points among them. So bacteria, most of the important bacteria we have covered here. Let me move on the virology. Okay, let's start virology quickly. Let's start quickly virology. Listen, this is a diagram of viruses in front of you. Viruses are of two types. Let me start virus. Everyone on the screen, please. Okay, all the viruses have a nucleic acid core. This is a nucleic acid core present in the viruses. Okay, all viruses have it. Okay, now the viruses are surrounded by protein covering, which is known as capsid. All viruses. The nucleic acid core is made up of either DNA or RNA, never both. The viruses have either DNA or RNA, never both. All the viruses have a protein covering. The protein covering is capsid, which is made up of capsomer. The capsid is made up of capsomer. The capsid is made up of capsomer. It is also in all viruses. But the third thing is not present in all viruses. Some viruses have enveloped, some do not have it. Hana? This one is known as enveloped virus, and this one is known as naked. Don't call it non-enveloped. There is a typical reason why I'm telling you, call it naked virus. The non-enveloped one is a naked virus. Okay, so there are two types of viruses. Okay, sometime on the envelope, you can see projectile spike-like projections are present, which are known as papillomas. It is also not present in all viruses. You can see the two diagrams in front of you. See the red colored nucleic acid present in both of them. See the capsid present in both of them. But see, this virus is having an envelope. This one is enveloped. And see, that one is not having an envelope. It is naked. This one is naked. Say yes if you got it. Okay. Now, everyone on the screen, listen. I want to tell you the classification of the viruses. The viruses are of two types. There are two types of viruses. What are the two types of viruses? We have DNA viruses. There are 6 families in DNA. You have to learn at the tip of tongue. I will give you a mnemonic. And RNA viruses. There are many RNA viruses, but in our syllabus, important 15 families are there. Again, I will give you a mnemonic. Inside the families, there are multiple members. But first, to learn the name of the families. Okay, chalo, DNA viruses. Start. DNA viruses. How many DNA viruses are there? The mnemonic is happy. Double H A triple P. Double H A triple P. What is double H? What is double H? Say double H. Say hepadina, herpes, adeno, parvo, papilla, pox. Okay, double H is hepadina, herpes. A is only one, adeno. And what are the 3 P? P is very confusing in virology. Triple P, parvo, papilla, pox. So it's double H, A triple P. P is always confusing in virology. People, P पे जरा ध्यान देना. P confusing होता है ना? चलो. H is hepadina and herpes. Very easy. Okay. A is adeno. A में कोई problem नहीं है. Triple P confusing है. What is triple P? Pox, parvo, papo. You have to learn. These are the 6 DNA. Coming on RNA. Okay, what is the mnemonic? I'm having 15 families for you. The mnemonic एक बार पढ़ेंगे. है ना? The mnemonic is ABCD for 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 ABCD for TPH. You can say tweet per hour. Or you can make parathermone PTH, whatever is your choice. है ना? TPH, PTH, जो बोलना है बोल लो. ठीक है? So A stand for arena. ठीक है? B stand for bunya. ठीक है? Rikitshi, I will take in the end, Akash. Don't worry. End में लेती हूँ. Let me finish Varo first. So A for arena, B for bunya, the 2C. The 2C is calci and corona. The 2 C's are calci and corona. D for delta. You can see D for delta. The 2F is philo and flavi. Okay. O is orthomyxo. ठीक है? Triple R. All 3 R are important. Rio, retro and rhabdo. T is toga. You can see T is toga virus. Where is toga? This one. And the 2P are there. One is picorna, one is paramyxo. And H is hepe. यहाँ का H hepe है. और वहाँ का H क्या था? Herpes and hepadina. So please write down the full form. Please say the full form. The 6 DNA and 15 RNA. 6 DNA are in front of you, 15 RNA in front of you. Please learn it by heart. Please. The mnemonics are in front of you. Learn the full form. Now, if you know the classification now, I want to teach you 5 important things in the classification itself. है ना? आधा virology तो मैं classification में करा दूंगी तुम्हें. The important things. Listen, everyone on the screen. Everyone. Okay. Among the 6 DNA, you know, these are the 6 DNA. Tell me which of them is single-stranded DNA and which of them is double-stranded DNA. Among the 15 RNA, you can see the 15 RNA in front of you. You tell me which of them is single-stranded, which of them is double-stranded. You know, DNA is a single-stranded molecule. I guess everyone knows from our childhood, we know that DNA is a single-stranded molecule. Hana? I'm sorry. DNA is a double-stranded molecule and RNA is a single-stranded molecule. Hana? Slip of tongue. So all the DNA are double-stranded because DNA is double-stranded now. So all of them is double-stranded except one. You have to learn the exception. The exception is parvo. Parvo is something unique. It is DNA yet single-stranded. DNA तो double-stranded होता है ना? ये parvo DNA होके भी single-stranded है. That is uniqueness in that. You have to learn that. Say yes. Say yes if you got it. Yes, you get question on parvo. ठीक है, चलो. Come on RNA. है ना? तो RNA पे हमें पता है. All the RNA are single-stranded. So I will write all are here. Except one. Again, यहाँ पे भी एक गद्दार है. एक गद्दार हर जगह होता है. So here also there is one who is going against the family. So who is going against the family here? Rio. So Rio is something unique. So Rio is the RNA virus. Ideally, it should be single-stranded, but it is double-stranded. It is double-stranded. Hana? So Rio. So Rio virus. Hana? So learn the 2 exceptions, parvo here and Rio there. Please learn it. The same thing is written in front of you. So all DNA viruses are double-stranded except parvo, which is single-stranded. All RNA viruses are single-stranded except Rio, which is double-stranded. Say yes if you got it. The second thing I want to tell you. The 6 DNA are in front of you. Tell me who's the newborn, who's the grandfather of this family. I mean, who's the smallest, who's the largest. Smallest I call newborn. By सबसे छोटा कौन है? Who's newborn in the 6? And who's the grandfather, the senior citizen? Call it senior citizen. Who's the most elder member among the 6? Okay, the same among the RNA. Among the 15 RNA, you tell me who's the newborn, who's the grandfather. Tell me. Acha, let me give you a clue. No, let me give you. I'm not so cruel. I will give you a clue. The clue is that everything's starting with P, 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 P. I told you, P is confusing. Anna, actually, it's not a clue. It's a confusion. It's a confusion. Everything starts with P. Okay. So let me tell you, let me help you how to learn. Let me help you. So among the DNA, the newborn is parvo. I learned parvo is a newborn girl. है ना? Parvo एक girl का नाम है. Imagine. Parvo is a newborn, cute little girl. You will never forget. It is the smallest member born today only. So among the DNA, the parvo is the newborn. That is the smallest member among the DNA. And Pox is the elder. The grandfather of this family is Pox. So you have to imagine Pox is a man, elder man, who's the grandfather, the senior citizen. And Parvo is a little cute girl. So the smallest one is Parvo and the largest one is Pox. Why I'm asking you to imagine like that? Because you will never forget. Otherwise, you will learn PPPP, you will get forget in your exam. This is like how I learned. Hana? Now coming on the RNA. Among the RNA, who's the smallest? The smallest one is the picorna. What is picogram? Nanogram, picogram, decogram. Have you read mathematics in your childhood? Pico matlab 10 to the power minus 12. It's very small. 10 to the power minus 12. So picorna. पिकोरना इज पिकोग्राम, मुझे पिकोरना से पिकोग्राम याद आता है, सो इट इज द स्मॉलेस्ट 10⁻12 है ना. एंड लार्जेस्ट वन इज पैरामिक्सो, मिक्सो के बड़े भाई है ना, मिक्सो के बड़े भाई इज पैरामिक्सो, सो दैट इज द सीनियर सिटीजन हियर. So learn picorna and paramyxo. You will never forget. So tell me the newborn and senior citizen here, and tell me the newborn and senior citizen here. So I'm asking you to have a look on the 4P. P. Have a look. I'm going out of the screen. Have a look on the P. The 4Ps in front of you. You get questions on that. Say yes. So the next thing, the same thing is written. One more thing I forgot to tell you. We are having two newborn. Hana? What are the two newborn? We are having parvo here, picorna here. Compare the two. Who is more small? Who is the overall smallest? So it is parvo only, है ना? And we are having two grandfathers. Who are the two grandfathers? One is pox, one is paramyxo. So if we compare the two grandfathers, who is more senior citizen? उनमें ज्यादा senior कौन है grandfathers में? So again the answer is pox. The answer is again pox. So the DNA one, the two DNA one are the overall also. So smallest DNA, largest DNA. Smallest RNA, largest RNA. Smallest overall, largest overall. 6 questions, 6 answers without any confusion. Everyone give me a thumbs up on this. Say yes. So learn the DNA smallest, largest, RNA smallest, largest, and overall smallest, largest. So everything P. The 6 P's. Say yes. Okay. Now the next thing. The next thing in front of you, there are 6 DNA, everyone knows. Which of them are enveloped? Which of them are naked? There are 15 RNA. Everyone knows. So which of them are enveloped? Which of them are naked? I told you not everyone is enveloped now. So how to learn? How to learn? You get questions on that, huh? Which of them are naked? Naked means non-enveloped, obviously. So there is a rule. What is the rule? What is the rule? The rule is that naked is always 3. Here also and here also. Naked is always 3. So 3 here, obviously 3 here because total is 6. And 3 here, so obviously 12 here because total is 15. Say yes. Got it. So I want all of you to learn the 3. I want you to learn the 3 naked. The remaining all are enveloped. Obviously, don't learn enveloped. Learn the naked. Learn the naked. So in DNA, naked is pop. Naked is pop. There is a mnemonic. The naked is pop. Poppy. Pop. You can learn. And here the naked is PCR. The naked is PCR. Hana? Remaining 12 are here. Hana? Remaining 12 are here. And remaining 3 are here. How many of you got it? Naked is pop and naked is PCR. You have to learn. Now, P. Say yes. Huh? So P में ही तो confusion है और P में ही मजा है. Huh? My name also with P. ठीक है? So listen. What is the P? You have to tell me the full form of P. Listen. Naked. We are having 3P here. No? Listen how I learned. There are 3P here. ठीक है? 3P में से 2 are coming here. 1 is not coming. Which is not coming? There are 3P. What are the 3P? Parvo, Pepova and Pox. Who's the Pox? Pox is the most senior. Senior को respect दो. Give clothes to grandfather. Give envelope to grandfather. Give clothes to grandfather. Give respect to grandfather. The newborn are naked. It's okay if the newborn is naked. There is no problem in that. So I will take parvo here. The parvo is naked because it is a newborn. No, newborn can be naked. It's okay. Papova is not a newborn, but it's a child. It's okay. Child is also naked. It's not newborn, but not the senior also. It's a child. So papova. So parvo, and there is no problem in A. A to एक ही है ना, adeno. This is how I learn. Hana? So parvo, peppo, and adeno. These 3 are naked here. The pox is not coming. Pox is enveloped. The same funda I will apply in RNA. In RNA, there are 2P. We are having 2P. Hana? Picorna and paramyxo. So picorna is naked. Picorna is newborn. Newborn naked bhi hua to chalega. There is no problem in the newborn naked. But paramyxo is the senior. Paramyxo hai. Respect to grandfather. Respect to senior citizen. Give clothes, give envelope. This is my point. You will get options. That's why. See, there are 2C, corona and calci. So we all know corona is enveloped and calci is non-enveloped. And there are 3 R. So one of them, Rio, is coming here. How to learn? How to learn? Say yes. Say yes. Okay. Thank you so much for your compliments. So please learn. The remaining all will come on the next slide. So we are done. So the same classification written in front of you. You can learn naked is PAP, naked is PCR. Learn like that. Now the next thing. Among the 6 DNA, you tell me how many are segmented into pieces. Answer is none. None of them is segmented. None of them is segmented. Among the RNA, how many? There are 15 RNA. How many is segmented? The RNA is divided into pieces. Yes, there are 4 RNA, which is in which the RNA is in pieces. It is in fragments or segments. I'm having a mnemonic. The mnemonic is Bora. B-O-R-A. You can learn the mnemonic. The mnemonic is Bora. You can say Bora is in pieces. The Bora is in pieces. What is Bora? Say the full form. So B for Bunia, you can see it is the same B. O for orthomyxo, you can see the same O. So we have seen the Bunia, we have seen the orthomyxo. There are 3 R. So one of them I'm taking Rio. हर जगह Rio ही आता है, Rio. And A is arena. So they have the RNA into pieces. है ना? So you have to learn the number of pieces also. 3, 8. 3 plus 8, 11. 11 and 2. This is how I learn. है ना? Okay, you can't see. I'm sorry. So let me write it again. Don't worry. है ना? So Bora. B-O-R-A. Bora is in pieces. Huh? What is the Bora? Bunia, orthomixo, Rio, and arena. This is how you have to learn. So it is RNA in 3 pieces, RNA in 8 pieces. 3 plus 8 is equal to 11. So RNA is in 11 pieces, and here RNA is in 2 pieces. How many of you got it? How many of you got it? So this is how. So you can get a question. Hello. So this is Bora. You can see how many pieces. You can get this image in your exam. Tell me, identify the virus. Spotter, identify the virus. Count the number of pieces the RNA is having. I can count 1, 2, 3, 4, 5, 6, 7, 8. RNA is in 8 pieces. So of course, the answer is orthomixo. It's the influenza virus. Hana? If RNA is in 3 pieces, I will say bunia. If RNA is in 8 pieces, 10 pieces, I will say Rio. Likewise, you can get the question. Come on, people, respond. You will are not responding. Huh? So we will revise. We have seen 4 things and we will revise all 4 and move further on the virology. This is general virology. We are done with general. Can we revise together? If you people commit that, yes, you will say the answers, then only I will revise. So let's revise it together. I want everyone to write down in the comment box, please. Huh? Among the DNA, tell me the single-stranded and the double-stranded. Among the RNA, tell me the single-stranded and double-stranded. Among the DNA, all of them are double-stranded except parvo, which is single-stranded. Am I right? Among the RNA, all are single-stranded except Rio, which is double-stranded. I've already explained you. Please learn it. Please learn it together. Among the DNA, the smallest one is parvo, the newborn here, and the grandfather here is the pox. Among the RNA, the newborn here is picorna. You can see picorna. And the grandfather here is bade bhaiya, paramixo. Mixo ke bade bhaiya. Learn it. ठीक है? And overall smallest largest are same as that of DNA. ठीक है? Among the DNA, है ना? Enveloped, I don't know, naked is PAP. You know what is PAP? And remaining all will be here. है ना? Among the RNA, the naked is PCR. है ना? And the remaining 12 will be here. ठीक है? Among the DNA, segmented is none. Among the RNA, segmented is Bora. Please revise it quickly, as quick as you can. Say yes if you're all done. If you're all done, you get questions on that. And many viruses we have covered here. And important things coming on the shape of the viruses. 3 viruses ki shape pe you get PYQs. Pox virus is brick shape. Appreciate it's brick shape. ठीक है? Rabies virus is bullet बंदूक की गोली. है ना? You can see it's bullet shape. You can get an image based question. है ना? Electron microscope image based question. Electron microscope. And the adenovirus is space vehicle shape. Can you appreciate the space vehicle shape? This is space vehicle shape, also known as satellite shape. You can get images also, you can get one-liners also. So this is important regarding the shape of the viruses. Can we go ahead? Say yes. Say yes. Can we go? Chalo. The next thing is the inclusion bodies. Okay, the next thing I want to tell you here is the inclusion bodies. Okay, G. What about the inclusion bodies? I must tell you here the important things in the inclusion bodies. What is inclusion body? The first thing, I'm sure everyone have heard this name by inclusion body. Inclusion. सुना सबने, पता कितनों को है? होता क्या है inclusion body? समझ में आता है? क्या होता है? You know, viruses multiply inside the host cell. Viruses don't multiply outside the host cell. Now see, this is a diagram of host cell, the yellow cell. Can you see this cell? It is human cell, inside which the virus is entering and multiplying. First understand this, then I will tell you what is inclusion body. See, this is a virus. The first thing is attachment. The virus is attaching. Can you see the virus is attaching with the host cell? Then it is penetrating. Can you see the second step is penetration? It is penetrating inside. The third step is uncoating, in which the capsid of the virus gets separated from the nucleic acid. The capsid separate, the nucleic acid separate. Both the things separate. That is known as uncoating. After that, multiple copies of the capsid and multiple copies of the nucleic acid is formed. That is the fourth step that is known as biosynthesis. So all the material is utilized from the host cell, and virus is making its own copies, multiple copies of the capsid and multiple copies of the nucleic acid. Say yes. After that, you know, maturation or assembly. So one capsid, one inclusion body, one capsid, and after that it is rupturing the host cell and coming out. It is rupturing the host cell and coming out. You can see the 6 steps. Virus is coming and attaching here. After that it is penetrating. After that uncoating. After that multiple copies are synthesized. That is biosynthesis. After that maturation or assembly. And then rupture of the host cell and coming out. See, everyone. So this is the point virus is entering. And one virus is entering. And this is the point multiple viruses come out. The point virus is entering here and the point virus is coming out here. In between, you cannot see a virus. The virus become invisible. It is known as eclipse phase. Eclipse को हिंदी में कहते हैं ग्रहण. Have you seen sun eclipse, moon eclipse, सूर्य ग्रहण, चंद्र ग्रहण? जिस भी चीज का eclipse है, that thing become invisible. So here I say virus eclipse. Virus is not visible. What if I see this cell under microscope right now? What I will see? So I will see certain dot-like structures. I will see dot, 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 dot inside the cell. These dots are known as inclusion body. So if I get an inclusion body inside any cell, है? It means that cell is virus infected. How many of you got it? Huh? How many of you got it? Huh? What is inclusion body? Inclusion body indicates that virus is multiplying inside that cell. We cannot see the virus because it is splitted inside the cell. But we can see the dot, 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 dot. That dot is inclusion body. So if we get inclusion body inside any cell, it means that cell is virus infected. There are three types of inclusion bodies. The three types are in front of you. So whether the inclusion body is in the cytoplasm, the dots are there. It can be in the nucleus or it can be the both. So three type of inclusion bodies are there. It can be intracytoplasmic, it can be intranuclear, it can be both. It can be both. So three type of inclusion bodies are there: intracytoplasmic, intranuclear, and both. So there are 5 examples here. You have to learn 5 examples here and 2 here. Total 12 examples at the tip of your tongue. You get questions on inclusion body very, very, very frequently. I can say almost every year you get question on inclusion body. So first understand what is inclusion body. The dot-like structures, it indicates the cell is virus infected and it is of 3 types. So let me tell you the 3 types of inclusion bodies right now. Okay. So coming on the intracytoplasmic. Here, can you see this is the cell? This is the nucleus of the cell. This is the nucleoli in the cell. I'm not interested in that. See the cytoplasm. Concentrate on the cytoplasm of the cell. Can you see the cell? See the cytoplasm. Can you see in the cytoplasm this dot-like structures, the pink colored dots? Let me mark. So you can see the pink colored dots. That is intracytoplasmic inclusion body. So learn the 5 examples. Learn the 5 viruses. So it is 1 RNA viruses and 4 DNA. In the DNA, all 4 are poxviridae family. The RNA is rabies. And in the poxviridae, it's vaccinia, variola, foulpox, molluscum contagiosum. You can see these are the members of the poxviridae. These are the members of the poxviridae. Okay, got it. Listen, Mahi, I cannot see the Zoom ka chat. Whatever is your query, Mahi, you can write down here. It's the same way. Okay. So there is no problem in that. You can write down your query because I'm having only one device. That is my phone in which I'm reading the chat right now. I'm not having 2 devices. In my system, I have opened this. And for opening the chat, I have to open it in the device. So if I close it in the system, that YouTube thing will be gone. So, it's very difficult to maintain the chat at the 2 places. But Mahi, if you have any query, open Hima. If you have any query, you can write down here. So I will respond here only. So please copy the query and you can copy it here. Okay. Okay. So, Acha, there you are responding whatever I am asking. Okay, got it. But you can respond here now because there is a limitation. I don't have 2 mobiles. I forgot to keep the 2 devices with me. Currently, I'm having only 1 device and I can open only 1 chat. If I open the Zoom chat, this chat will be gone on the YouTube. So I can be attending the chat at one place. That is the only limitation, but I'm really sorry for that, for the inconvenience you people are facing. But we can compile the chat at one place here on the YouTube if you say. Okay, done. Okay. Okay, Ji. Okay, so chalo, let's continue. So I was teaching you the inclusion bodies. Okay, so rabies is the RNA virus and vaccinia, variola, foulpox, and molluscum contagiosum. These are the DNA viruses. Now you have to learn the name of the scientists who have discovered the inclusion body in them. So in rabies, it's known as Nigri body. In vaccinia, it is known as Guinneri body. In variola, it is known as Paschen body. In foulpox, it's Bollinger body. In molluscum contagiosum, it's Henderson-Peterson. I know it's difficult learning the name of the scientist, but if you read it once, you will identify the options. Okay? You will get confused in the 2 VV. Though the V, you will get confused vaccinia and variola. So I'm having a mnemonic for you. Gauri had a vaccine. Mnemonic is. Gauri is Guinneri or vaccine is vaccinia. Now you'll never forget. Gauri had a vaccine. So Guinneri, vaccinia. Got it. This is intracytoplasmic. So I told you 5 are here. The 5 intracytoplasmic, I told you. Let me come on the 5. Let me come on the 5 intranuclear. In the intranuclear, we have 2 types. Cowdry type A, Cowdry type A. Type B. You will say, ma'am, what is Cowdry A, Cowdry B? Ab ye kya tanta hai? What is the problem? So this is intranuclear. This is also intranuclear. Both of them are same. But the only thing, it's granular here and it's compact here, circumscribed here. This is known as Cowdry A. Cowdry A is granular. And Cowdry B is compact. Both are intranuclear. Here we have 3 viruses, 3 examples. Here we have 2 examples. Total five. Intranuclear total five. So the three examples here, mnemonic is heavy, HVY. And here PA, heavy PA. The mnemonic is heavy PA. It's herpes, है ना? V से varicella zoster and Y से yellow fever. ठीक है? And PA, polio and adeno. It's very easy. Heavy PA, intranuclear. Heavy PA, intranuclear. Three of them is quadri A, two of them is quadri B. Quadri A is granular, quadri B is circumscribed. So learn heavy PA. You have to learn that. है ना? In herpes, it's known as Lipschul's body. And in yellow fever, it's known as Story's body, the name of the scientist. And here we don't have any other name. Okay, Cowdry A, Cowdry B. And in both, you have to learn the name of the two viruses. Okay, measles and cytomegalo. Measles and cytomegalo, CMV. Measles and in measles, it's known as Warden-Finkeln. Okay, and in cytomegalo, it's known as owl eye appearance, ulluki eye. Can you see owl eye appearance? Typical owl eye. It's looking the owl eye. The inclusion bodies are present inside the nucleus also and in the cytoplasm also. It's typical owl eye appearance. इस पे बहुत question आता है. Can we fill it together? If you are comfortable, can you tell me? Once we will fill it and move ahead. Huh? Intracytoplasmic बताओ. चलो quickly बताओ. Intracytoplasmic. Tell me 5 examples here. Here, Cowdry A में, tell me 3 examples. Cowdry B में, tell me 2 examples. And tell me finally 2 examples here. So total 12 examples you have to tell me. Tell me first name of the virus. Scientist को बाद में देखते हैं. First tell me the name of the virus. Intracytoplasmic में rabies, vaccinia, variola, है ना? Fowl pox and molluscum contagiosum. Tell me the name of the scientist correspondingly. Rabies में it's known as Negri body. Vaccinia, Gori has a vaccine, so Guinneri body. Variola में Passion body, है ना? Fowl pox में it is known as Bollinger body. And molluscum contagiosum में Henderson-Peterson body. This is how you have to learn. ठीक है? यहाँ पे heavy PA. I'm having a mnemonic. It's heavy, HVY and PA. ठीक है? Herpes, varicella zoster, yellow fever, polio and adeno. ठीक है? Tell me the name of the scientist. We have at only 2 places. Herpes में Lipschul's body, yellow fever में Torrey's body. ठीक है? Finally, last. Here we have 2, measles and cytomegalovirus. In the measles, it's known as Warden-Finkeln body. And in cytomegalo, owl eye appearance. How many of you got it? You frequently get questions from that. Now you have to learn it. Okay, so let's continue with virology. That was all about the general virology. Now specific viruses, I will teach you only 2-3 specific viruses because you know we have to cover the parasite and myco also. Okay, so specific viruses, I will teach you here pox virus, the ultra important pox virus. Pox virus, may 2 viruses are important. One variola and one molluscum contagiosum. I will teach you both. Variola causes smallpox. Smallpox is a disease which is eradicated from the world. You know, only one disease is eradicated from the world till date. The name of that disease is smallpox. So the remarkable date is 8th May 1980, before you and me were born. By the way, I am also born after 1980. Okay. So we all are born after 1980. Before we all are born, this disease is thankfully eradicated. Got it? This is the disease smallpox. Now you have to differentiate the smallpox from the chickenpox. Okay, smallpox, rash from chickenpox. Chickenpox is also caused by a virus, but different virus. It is caused by one of the herpes virus, that is varicella zoster. But the rash of the two looks alike. You will say, ma'am, why we have to differentiate smallpox? So hota nahi hai. If such a presentation is coming now to me, I'm a doctor, if such presentation is coming to me. So of course it's chickenpox because smallpox is eradicated. But you know, in the previous era, when both were occurring before 1980, doctors have to differentiate. Lekin question to ab bhi aata hai. So that's why you have to differentiate the rash of the two. Okay, now see, you can see the 2 diagrams in front of you. You can see here, I'm telling you smallpox this side and I'm telling you chickenpox this side. You can see the 2 diagrams. Okay, smallpox is caused by one of the DNA virus, pox virus. The family is pox, the virus is variola. Chickenpox is also caused by DNA virus. The family is herpes and the virus is varicella zoster. है ना? Double H, triple P का ये H है, ये P. Both of them are DNA viruses. Here the rash start from the center and go to the periphery. It's centrifugal, away from the center. It's centrifugal. Here the rash start from the periphery and come towards the center. Come towards the center. It's centripetal. Centripetal. It's come towards the center. How to learn centrifugal and centripetal? I always say CP for CP. Centripetal chicken pox. Hana? I say again. Chicken pox, centripetal. No, you will never forget. CP for CP. So in chicken pox, you can see chicken pox. The rash is centripetal. Say yes if you got it. Now learn the one area which is paired. In smallpox, axilla is never involved. Never. Axilla never involved. And in chicken pox, palms and soles are never involved. The palms and soles is never involved. See, palms and soles is never involved. So learn one organ which is paired. So learn the virus. Both of them are DNA viruses. Learn centripetal, centrifugal. Learn one organ which is paired. Okay. Now see the rash. If you rupture here, the rash, you can see all of them are either vesicle or papule or pustule. So all of them are in same stages. That is, rash is non-pleomorphic. And here you can see some are vesicle, some are papule, some are pustule, some are, so it is rash is pleomorphic. In smallpox, it's non-pleomorphic. In chickenpox, it's pleomorphic. That is the meaning. Okay. If you rupture here, one of the rash, you will see it's multi-compartment and very deep. And if you rupture one of them here, you will see it's very superficial and unicompartment. Compartment is one. Here around the rash, we can't see any inflammation. Here around the rash, you can see the redness. The redness is the inflammation. Okay, the redness is the inflammation. So here inflammation is present. So you get many questions on that. Okay, that is variola. Now one more virus, molluscum contagiosum is there. In the pox viridae, molluscum contagiosum is there. Molluscum contagiosum the rash typically have a hole at the center. There is a depression at the center. There is a dimple at the center. Typical, it is known as umbilicated rash. Umbilicated rash. The rash have a depression at the center. Is the question. Okay, how many of you got it? One more virus I will tell you after poxvirus here. Parvovirus. Frequently, almost every year you get a question on parvovirus. Very important virus. Parvovirus. So you have to learn the smallest one, the newborn in this family. The newborn which is naked. In this family, you know it is newborn, it is naked. It is the only DNA virus which is single-stranded, rest all are double-stranded. Tell me the diseases caused by parvo. I'm telling you parvo here. Tell me the diseases caused by parvo. Parvo kya karata hai? So parvo have different presentation. In fetus, what does it causes? In children, what does it causes? And in adults, what does it causes? Okay, in fetus, this is a fetus. This is a fetus, the bone marrow of a fetus. So parvovirus B19 enters inside the fetus via placenta of the mother. The mother is infected. It is going to the fetus. In the bone marrow, we have hematopoietic stem cells, which form RBC, WBC platelet. So parvovirus hit the RBC precursor. Only RBC precursor. So RBCs are not formed. WBCs are formed, platelet are formed, but RBCs are not formed. The name of the disease is aplastic crisis. What is the name of the disease? The name of the disease is aplastic crisis, also known as PRCA, pure red cell aplasia, because only RBCs are not formed, but WBCs and platelets are formed. It's PRCA, pure red cell aplasia, also known as aplastic crisis. So that is in fetus. The fetus will have severe anemia, congestive heart failure because of that, abortion, hydrocephalus, and death. So you can see this is the presentation in the fetus. You all can see in fetus. In the fetus, severe anemia, PRCA, aplastic crisis, congestive heart failure, hydrocephalus, and abortion. That is fetus. You can read fetus mein. Anemia, aplastic crisis, PRCA, heart failure, hydrocephalus, abortion. That is fetus. What about children? See this child. It is looking the mother have slapped the child. The mother have slapped. Someone slapped the chick. What happens? The chick become red. It is looking the red chick. The cheek is red. It is looking someone have slapped, but no one has slapped this child. It is looking like that because parvovirus causes cutaneous vasodilatation, especially the face and the cheek area. Parvovirus causes vasodilatation of the cutaneous blood vessels, especially of the cheek area. Say yes if you got it. It is known as slapped cheek appearance. Slapped cheek. Since the cheek become red, it is also known as erythema infectiosa. Erythema. And after the virus enters in the body of the child, it presents on the 5th day. That's why it's also known as 5th day disease. 5th day. So one and the same. Whether I say 5th day, whether I say erythema infectiosum, or whether I say slapped cheek appearance, the meaning is the same. The meaning is the same. In adults, it causes arthralgia. Arthralgia, especially in the wrist joint. Especially. So please, you get the question on the parvovirus. It is not always, the answer is always slapped cheek. You get tempted looking at the word slap check. Depending question kis pe hai. The question is on fetus, or the question is on child, or the question is on adult. Depending on that, your answer should vary. Options mein yahi sab hoga. If it's the fetus, the options mein you will get PRCA, or you will get aplastic crisis, or you will get hydrocephalus, or you will get congestive heart failure or abortion. So that is the presentation in the fetus. In the child, it's slapped cheek appearance, also known as erythema infectiosum, also known as 5th disease. So that is the presentation in a child. In adults, it's arthritis in the wrist joint. In adults, it's arthritis. So there was a question last year in FMGE only. What is the presentation of parvovirus in an adult? Option A was slapped cheek appearance. Option D was arthritis. B and C was something like that. Students get tempted. Oh, parvovirus, slapped cheek, mark kar do. Read the question, read the option. They are asking in adult. They are not asking in children. Hana. So, sometimes you get tempted. Okay, got it. Of course, I will finish it at 6:15 sharp. Okay, open email. The slot given to me is till 6:15. After that, you will get a break for 10:15 and 6:30 onwards, you will have a next session of physiology. 6:15 sharp, I will end my session. Okay, chalo. Can we continue? Okay, listen. Okay, chalo. So let's continue. So we are done with this virus. Now I'm coming on the parasite. Just a second. So let's come on the parasito. Few important parasites we will have a look here. Before parasito, let's have a look on the myco. I know myco is very small. In the parasite, I have to teach you the acts. Okay, so let's come on the mycology. Chalo, let's start mycology. Hana, we have seen bacterio, viro, general. Now let's start the mycology. Okay. In the mycology, these are the funguses. You can see the various funguses are there. We divide the funguses in 4 categories. Superficial mycosis. These are the 4 fungus which cause superficial mycosis. They involve the skin, the keratin, the skin, nail, and hair, the keratin, the dead skin. These are known as superficial mycosis. The next 4, they involve the subcutaneous tissue. Just below the skin, there is subcutaneous tissue. They involve that. After that, the deep mycosis. The deep mycosis. These 4 cause deep mycosis or systemic mycosis. They go inside the blood and involve multiple organs. So these 4 involve only skin, hair, and nail. These 4 involve the subcutaneous tissue. These 4 first enter via respiratory route, involve the lungs, and then involve multiple organs. And 4 of them are opportunistic. The last 4 are opportunistic. They cause infection only when the person is immunocompromised. They do not cause the infection in a healthy individual. They cause the infection in immunocompromised people like HIV, like patient on steroids, or, the patient is on chemotherapy like that, or post-transplant. So first thing you have to learn the classification. Say yes if you got it. Say yes. Anna. So 4 plus 4 plus 4 plus 4. I will teach you 16 fungus in the next 16 minutes. I will give 1 minute to one fungus. Hannah, let's try it. Hannah, let's try it. Okay, so all 16 fungus. You can see 4, 4, 4, 4. 4 are superficial, 4 are subcutaneous, 4 are systemic, and 4 of them are opportunistic. So you have to learn in a tubulated way. I call them master tables. I have already provided the master tables everywhere. Hannah. So please read all the organisms, especially the mycology from the master tables. So let's start the first 4. Let me start the first 4 superficial mycosis. So here the 4 fungus are dermatophytosis, tinea versicolor, tinea nigra, and pedra. So these are the 4 diseases. है ना? ये सब diseases के नाम है. Tell me the fungus which is causing this disease. So these are the 4 diseases. The first 4 superficial. They involve the skin, hair, and nail, the keratin, the dead skin. है ना? The dead layer. Okay. So tinea versicolor is caused by Malassezia furfur. This is the fungus causing it. ठीक है, tinea nigra is caused by Hortia wernicki. This is the fungus causing this. Okay, pedra is a disease of hair. There are 2 types of hair disease. I will show you the images. Black pedra and white pedra. The black pedra is caused by Pedia hortia, and the white pedra is caused by Trichophyton bigeli. I know the names are difficult, but looking at the option, you will identify. The good thing is that it's not a subjective exam. It's an objective exam. You will get the 4 options. From the 4 options, you can easily click. It is an option, you can take it out. Ye ma'am ne bataya. So, you don't have to write the spellings. Just have a look. You have to identify them in the option. Bhai, likhna nahi hai. Identify karna hai. Utna kar lo. Theek hai. And last one is dermatophytosis. In the dermatophytosis, 3 species are there. 3 genera are there. Trichophyton, Microsporum, Epidermophyton. So learn the name of the fungus causing the corresponding disease. Now, one by one, we will take them. So first one, tinea versicolor. Isme kya hota hai? Patient have 2 symptoms. Patient have hypo and hyperpigmented patches and dandruff. Dandruff. You can see the dandruff. Okay, see the dandruff. Can you see the dandruff? Can you see the dandruff here? Dandruff in the hairs, skin of hairs. It is known as seborrheic dermatitis. So patches and seborrheic dermatitis. Appreciate the patches, appreciate seborrheic dermatitis. These 2 things occurs in tinea versicolor. The 2 things, patches and dandruff. Diagnosis ke 3 tarike. Let me tell you the 3 ways of diagnosing versicolor. 1, 2, 3. 3 ways. तीनों पे PYQ है. तीनों पे PYQ है. Believe me. तीनों पे. First, do a direct microscopy. On direct microscopy, you will get spaghetti and meatball appearance. What is spaghetti? Spaghetti is noodles, Maggie. Can you see the image? Noodles. And meatballs, although I'm a vegetarian, I will say cheese balls. So you can see it's a dish. These are the meatballs. And you can see this is the spaghetti. It is the spaghetti. The 2 are mixed together. Now see the fungus. You can see it is having the hyphae. The hyphae is like the noodles. That is spaghetti. And it is having the yeast. The yeast is looking like the meatball. So compare the yeast with the meatball and compare the hyphae with the spaghetti. It is known as spaghetti meatball appearance. Say yes if you all got it. Please learn. You get a question on that. The second is the culture. On SDA agar, it gives fried egg colony. You get a question on that. Can you see the egg? The white, the yellow. The colonies are looking like that. The white, the yellow. It's like that, fried egg appearance. On wood lamp examination, which is UV light, if you put the UV light directly, if you put the UV light over the patient dandruff or any affected area, you will get the golden fluorescence. You will get the golden fluorescence like that, golden fluorescence, because it is a pigment producing fungus. So that is the golden fluorescence you will get. So learn the 3 ways of diagnosing. Tinea nigra, it produces black color lesion, non-painful lesion over the palms and soles. That's it. Tinea nigra. I told you it's caused by Hornea wernicke. Tinea nigra. Pedra, there are 2 types of pedra, the black and the white. Here it produces nodules in the hair. The black nodules in the hair, the white nodules in the hair. You can see black nodules, white nodules. The nodules in the hair. The black pedra is caused by pedra hortea and white is caused by trichophyton decay. Okay, that is pedra. And dermatophytosis, इसे हिंदी में कहते हैं दांत. That is ringworm. Ringworm. It can occur in the skin, hair, and nail. तीनों में हो सकता है. The tinea can occur in all 3. Okay, so that is the tinea. Okay, so we are done with these 4 fungus. We have seen in detail these 4. Let me come on the next 4. Ultra important. Every year, make a 5-star over it. Please highlight the next 4. Subcutaneous. Every year you get a FMGE question on that. Mind my words. You please check if you don't believe. Every year. Out of the 5, 1 question pakka. ठीक है. Mycetoma, sporotrichosis, chromoblastomycosis, rhinosporidiosis. I teach in this manner. See the 4. See the 4 together at one place. Everyone see 4 at one place. Okay, listen. Mycetoma, okay, chromoblastomycosis, rhinosporidiosis, and sporotrichosis. Okay. Mycetoma, it is presented with multiple sinuses, multiple discharging sinuses. If you press, the pus will come. And if you palpate, the pus have the sulfur granules in that. If you crush the granule, you will get a colony of the fungus. It is typical presentation, especially the foot area. Foot mein. It is known as Madhura foot because first time it is discovered in Madhura of South India. Madurai of South India. It is known as Madhura foot. So multiple sinuses. You can see the patient will come to you, doctor, I'm having multiple sinuses. It is discharging. It is having the pus. If I press, the pus come out and pus is not uniform. It's having granularity. And if you crush the granule, you will see the fungal colony. Say yes. Okay. And if you do the biopsy, you will get sun ray appearance. It is known as sun ray. Sun ray appearance. What it is known as? Please write down. Sun ray appearance. Sun ray appearance. Okay, see the presentation, see the biopsy. The second is chromoblastomycosis. The presentation is verrucous lesion. You typically get a question, the patient is having a verrucous lesion after a thorn prick. Thorn prick is kanta laga, hai laga, है ना? So typically it's a disease of gardeners. It's a disease of gardeners. The question will start like a gardener. So gardener is always giving a clue. Gardener means the thorn pricks are common. Or you will get a question, there is a person, there is a male, female having a thorn prick. Jahan pe bhi thorn prick hua, wahan pe verrucous lesion. So after the thorn prick, there is a verrucous lesion. And if you do the biopsy, this is the biopsy. What do you see in the biopsy? In the biopsy, I can see brown color yeast. Oh my God. Brown color pigment producing yeast. Brown pigment. It's looking like copper panny. Copper panny. Copper ki panny is lag rahi hai brown color ki. Also known as sclerotic body. Sclerotic body. What is known as? Say sclerotic body. It is known as copper pannies or sclerotic bodies. So see the presentation, see the biopsy. So here, see the presentation. Here you have the multiple sinuses with sun ray appearance. Here, after a thorn prick, verrucous presentation with copper panny or sclerotic body. Now coming on rhinosporidiosis. By the way, rhinosporidiosis is no more a fungus nowadays. We consider it a parasite and a protista, aquatic. So currently its taxonomic classification has changed. Got my point. Currently it is very recently changed. So now it is no more fungus. Pehle to. Lekin still I'm teaching you in fungus only. ठीक है? It remains in water. So swimming से it enters. So there will be a typical question swimmer. उसके बाद swimming के बाद polyp, strawberry polyp, especially in the nose, in the mouth, in the larynx, in the ears, in the conjunctiva, in the genitalia. कहीं भी हो सकता है. लेकिन mostly it is in the nose. If you do the biopsy of the polyp, this is the biopsy. सबका biopsy भी देख लो corresponding. In the biopsy, you will get the spirules. In the biopsy, you will get the spirules. Can you see the spirules are there? Typical spirules are there. Spirules. One spirule contains hundreds of endospores. Okay, spirules. Write down the word spirule. Spirules are there. So see, sun ray appearance there. See, copper panny or sclerotic body here. See, spirules here. Typical presentation. You will get image-based questions also. Okay. The next is sporotrichosis. Again, it enters via thorn prick. है ना? लेकिन यहाँ पे special है. गुलाब के कांटे से enter होता है. Rose thorn prick. So beware of giving roses or accepting roses from anyone. Okay. So it is typically from the rose thorn prick. है ना? Rose thorn prick से typically होता है. So there is a rose gardener. Typical question. Or simply gardener they give. लेकिन thorn prick is must. ठीक है. जिस point पे भी thorn prick होता है, there is the ulcer at that point. Suppose here is a thorn prick. So there is an ulcer at that point. After that, the fungus enters in the lymphatics. It is entering in the lymphatics and cause multiple ulcers in a series in the direction of that lymphatic. Typical presentation, multiple ulcers or nodules in a series. I repeat, multiple ulcers or nodules in a series. Got it? Because the fungus is entering in the lymphatic. And if you do the biopsy, it's very peculiar. You will get star. Can you appreciate the star? Star, twinkle, twinkle, little star. It's like that. Can you see here? The stars are there. Huh? What is astrology? Astrology is the study of stars. So we call these bodies as asteroid bodies. Asteroid body is astrology se aaya hai. You know, studies, it's star looking. And if you've seen a cigar, have you seen a cigar? This is a cigar. Cut the cigar from here and see from the transverse view. So cigar also looks like this. And from the transverse view, it's also looking like the star. Transverse view, not the longitudinal. So the asteroid body, also known as cigar body. No, one and the same thing. So either say asteroid or cigar. Say yes, people say yes. You are going to get one question from here. Either image-based or clinical-based or simple theory question. Say yes, please learn it. So please learn. Mycetoma, the presentation is sundry appearance. Chromoblastomycosis, the presentation is copper pannier sclerotic body. Hana, rhinosporidiosis, the presentation is spherules. And sporotrichosis, the presentation is asteroid body or cigar body. Everyone give me a thumbs up. So please learn it. It's very important. Can we go ahead? So see the question. You can see the question here. Anna. So traumatic. Traumatic means it is having a trauma. I mean, the thorn prick trauma can be there. And see the typical image. It is sporothrix. See the image. Typical. It's mycetoma. Anna, looking at the image only you can answer. See the image. In this image, you can see the brown color yeast. Anna, I can see the brown color yeast. Anna, and typically verrucous body. And typically gardener. Typically thorn prick. Compiling all the clues together. The answer will be sclerotic body or copper pan. So you are going to get question on that. Can I come on the next four? We are done with these four. We are done with these four. Let's come on the next four. The next four are systemic mycosis. Systemic or deep mycosis. So here the four are there. You can see histoplasmosis. It is present inside the macrophage and it is like a budding yeast. It is like a budding yeast. It is budding. It is budding with a narrow base. Blastomycosis is also budding yeast, but it's a broad base. Let me tell you. So I'm teaching you two things, histo, blasto. Histo and blasto. This is budding yeast, but with a narrow base. With a narrow base. And this is budding yeast with a broad base. Please learn. This is broad base. B for broad and B for blasto. B for broad, B for blasto. See, both of them are budding yeast. This one is narrow, this one is broad. How many of you got it? Narrow base and broad base. So here we compare it with figure of 8. 1, 2, 3, 4, 5, 6, 7, 8. The figure of 8. The digital 8 is written like this. So this one is compared as figure of 8. Figure of 8 pe question aata. You get, Hana? So this one is figure of 8. See, so here also budding yeast, here also budding yeast. ठीक है, coccidium is spherule. Again spherule, write the rhino. Spherules, it's spherules. And last paracoccidium mein, either there is two small buds. It's looking like a cute Mickey Mouse. Can you see the Mickey Mouse appearance? It is known as Mickey Mouse appearance. Can you see the Mickey Mouse? Or it is having multiple small buds like this. It is known as pilot wheel appearance. So either Mickey Mouse or pilot wheel. So we are done with these four. So learn the presentation. That's it. So learn these four, the last one. The last one, the last four, the opportunistic, the candida. The most important fungus here is candida. The most important, the most common fungal infection in human is candida. Okay. The only fungus which is having pseudo-hyphae. The question mein, kitna hi bada presentation ho. If you are getting the word pseudo-hyphae, answer is going to be candida. Candida. There are many types of candida. The most important is albicans. Others are also there. Now tell me a way how I separate the albicans from all others. Tell me a way how I separate the candida albicans from all others. Can you tell me one way by which I can separate the candida albicans from all others? Can you tell me a way? Yes, there are three ways. Is pe question aata hai. This is known as speciation. How we are doing the speciation? Candida albicans like the serum, rabbit ka serum. Candida albicans like the corn, bhutta. तुम्हें अच्छा लगता है? I like corn. Candida albicans also do. So take your Candida albicans, and mix rabbit ka serum. Rabbit serum in that. Incubate it for 2 hours. Incubate it. After that, make a smear. Make a smear. If it is albicans, you will see the germ tubes. you will see the germ tube. If it is any other candida, no germ tube. It is known as germ tube test, also known as Reynolds-Brown phenomenon. Say, so take the specimen, mix it with the serum, the rabbit serum, incubate it for 2 hours and make the serum. You will see if albicans is there, it will form the germ tube. Other candida will not make the germ tube. It is germ tube test, also known as Reynolds-Brown phenomenon. Okay, now take your specimen, and take your SD agar. This is not simple SD agar. It contains cornmeal, the commercially available cornmeal. Bhutta add kar do. Now try to grow a candida on it. If it is Candida albicans like corn, usko bhutta bada pasand hai na? It will make the chlamydophore. If it is not Candida albicans, it will not make. This experiment is known as cornmeal agar experiment, also known as Dalmau plate experiment. And lastly, there is the chrome agar. Recent question hai chrome agar pe. So here it gives different color to different candida based on their specific enzyme. Chrome ka matlab hota hai colors. Different candida have different colors. How many of you got it? Learn the 3 experiments. Learn. This is germ tube, this is Dalmau, this is chrome. Say yes. The next is Cryptococcus, only fungus which is capsulated. You can see the capsule. See the fungus and see the capsule over it. See the fungus, see the capsule. So we use a negative stain. Who's attending my lecture from the beginning? Have I taught you what is negative stain? India and nigrosin. Here we stain the background, not the organism. So the organism will stand out on a black background. So this is negative stain. So we use negative stain for Cryptococcus. That is the only capsulated fungus here in our syllabus right now. Okay. The last two fungus is Aspergillus and Zygomycosis. In the Zygomycosis, we have 2 fungus here. Mucor, most common cause of orbital cellulitis, and Rhizopus. Okay. Now see, both of them are forming the hyphae. Tell me the difference in the hyphae. Who will tell me the difference? See, the hyphae here is narrow. The angle is also narrow. It's 45-degree branching. Aspergillus. Here the hyphae is broad. Can you see the thickness? It's broad. And see the angle. The angle is also broad. See the angle. The angle is obtuse, or it is more than 45. It's a broad angle. So the hyphae is narrow. The angle is narrow. Here the hyphae is broad. The angle is broad. And third thing, this one is septate. And this one is aseptate. This one is aseptate. We are done with microbiology. Say yes. I taught you all 16, all 16 fungus here. The important points. Say yes. The last thing, parasitology, the important things I will tell you the approach, how to read my master charts and how to go with the parasitology. The first thing, what is a parasite? Parasite is the organism which resides on another organism. The name of another organism is host. Parasite obtain 2 things from the host. Ek to khana, that is food, and दूसरा shelter. दूसरा मकान. 3 चीजें लगती हैं जीने के लिए. रोटी, कपड़ा, मकान. कपड़े तो ये पहनते नहीं हैं. So roti or makan. I mean, the food and shelter is obtained from the host. So parasite is an organism which reside on another organism for 2 things: the food and the shelter. Badle mein, parasite what giving to the host? What the parasite giving to the host in exchange? It's disease. So it takes 2 things and give disease. So this relationship is known as host-parasite relationship. So yes, if you got it. No, you have to learn the classification. Have a look on the classification. I guess you already know. Parasites are of 2 types. Protozoa are the unicellular, metazoa or helminth are the multicellular. So the 2 type of parasites, unicellular, multicellular. Metazoa or helminth are one and the same thing. Whether I say metazoa or whether I say helminth, it's one and the same thing. It's multicellular. So protozoa are unicellular, metazoa are multicellular. Protozoa are divided in 5 categories. And metazoa are divided into 3 categories. Okay, got it? So what are the 5 categories? Thank you so much, Akshit, for the concern, but I'm good. Okay, chalo. So the 5 categories in the protozoa, they are in front of you. So there are amoebas. Okay, we are having amoebas, flagellates, sporozoans, ciliates, and microsporidia. You can see. These are the 5 categories here. And metazoa, the 3 categories is cystode, trematode, nematode. Okay, chalo, listen. So how I'm commencing the parasitology in the next 20-25 minutes? See. I will tell you the gist, the complete crush of the parasitology. Everyone here. How many amoebas we have? The amoebas are of 3 types. You can see here. Only one of them is pathogenic amoeba, which cause disease in human. I guess everyone knows it's Entamoeba histolytica. If you don't know, learn it. And 3 of them are free living, which are neuroparasite. These are known as brain eaters. They affect the human brain. What are the 3? Naegleria floweri, Acanthamoeba, and Balmothea. So here, Entamoeba histolytica, you get very frequent MCQs. I will teach you this right now. After that, flagellates are there. How many types of flagellates are there? Depending which human organ it involves. If it is involving the intestine, the most important is Giardia lamblia. If it is involving the genitals, it's Trichomonas vaginalis. And among the hemoflagellates, if it is present in the blood, there are 3. Leishmania, Donovani, Trypanosoma brucei, and cruzi. Okay, so you get simple question. Which of the following is a hemoflagellate? Which of the following is an intestinal flagellate? Which of the following is a genital flagellate? So based on the classification, which of the following is the pathogenic amoeba? Which of the following is a free living amoeba? So if you know the classification, the half things are done. Okay, so flagellates are there. Among the sporozoans, all the sporas are there. सारे स्पोरा आ जाएंगे, है ना? I mean isospora, cyclospora, cryptospora. उसके अलावा plasmodium and babesia. The most important here is the plasmodium. Okay, उसके अलावा ciliates. Ciliates में एक ही आता है Balantidium coli. इस पे एक ही क्वेश्चन आता है B for बड़ा. ये सबसे बड़ा है. B for this is the largest protozoa. Among all the protozoa, they all are unicellular. The largest one is Balantidium coli, which is one of the ciliates. You get question on that. And last one, microsporidia is not important. It is having only one organism, microsporidia. Okay, right. Now, I want you to learn this thing for all parasites. Hana, I have provided you master charts. Hana, ultimately you have to learn those master charts. I have summarized the entire parasitology in just 8 pages. In 8 pages, I have compacted all the important parasites, the 20 parasites which are there in your syllabus among these headings. You should know the morphological forms of all of them, mode of transmission, infective form, definitive host, intermediate host, and pathogenesis. And lab diagnosis may have any special test is there, otherwise not. Okay, if you know this, you are going to rock parasitology, each and every question you can do. Okay, listen now. So let me tell you few examples how to go with that. है ना? Directly if I say कि चार जाके घर जाके खुद पढ़ लेना, तो this is not the way. है ना? Let me tell you one. है ना? Let me tell you one parasite Entamoeba histolytica here. ठीक है, let's fill this column for Entamoeba histolytica. I will take just 1 minute to complete this parasite. है ना? I will explain you each and everything of Entamoeba histolytica. See, there are 3 forms. है ना? It is having a trophozoite, it is having a precyst, and it is having a cyst, which is of 3 types. We are having a trophozoite, we are having a precyst, and we are having a cyst. Okay, the trophozoite, you have to see the shape. In the shape, you can see there is a pseudopodia. It's amoeba having a pseudopodia. You can see 2 cytoplasm, ectoplasm, endoplasm. Ectoplasm is clear, you can see. And endoplasm is granular, having the cells in that. It is having RBC and WBC. Oh my God, it's a unicellular organism. इसके अंदर RBC, WBC कहाँ से आया? From where it is getting RBC? It is having cardiovascular system. Is it having bone marrow, which is synthesizing RBC, WBC? No. This trophozoite is going in human intestine, and it is attaching on the human intestine and ingesting RBC and WBC of the human. So you can see the RBC and WBC inside the cytoplasm of this parasite. It is the human RBC and WBC present here. It's a unique thing. So it is known as erythrophagocytosis. You get question on that. Erythrophagocytosis. Say yes. Erythrophagocytosis. This one is erythrophagocytosis. How many of you got it? Yes. So this is trophozoite. This one is precyst, nothing important. And cysts are of 3 types. You can see here it's uninucleate, only 1 nucleus. Here binucleate, 2 nucleus. And here quadrinucleate is 4 nucleus. So most important is quadrinucleate, having 4 nucleus. So see the morphological form. What's the mode of transmission? It's eating, it's ingestion. Can you see the girl? The girl is eating. So parasite enters, Entamoeba histolytica enters via eating. So route is ingestion. It's not inhalation, it's not swimming, it's not sexual intercourse, it's ingestion. What is entering? Is it trophozoite? No. Is it precyst? No, it is cyst. Which cyst? It's quadrinucleate cyst. The quadrinucleate cyst is entering. So can you see quadrinucleate cyst is the infective form. And man is the only host. Rather, I would like to draw. Please, everyone, each and every one of you on the screen. So this person is eating the food. This is the same girl I'm drawing on the next page. So she is eating the food and water which is contaminated with quadrinucleate cyst. The cyst is going inside, eating. है ना? It is going inside. In the small intestine, it will rupture. From one cyst, 4 trophozoite are formed in the small intestine. From one cyst, 4 trophozoite are formed. Now, cyst and trophozoite, both of them will move into the cecum. They will move, and they go in the cecum. In the cecum, we have cyst also, which are not ruptured, and which are ruptured. They converted into trophozoite. We have trophozoite also. So in the cecum, cysts do not cause anything. Trophozoite will ulcerate in the cecum and produce flask-shaped ulcers there. Flask-shaped ulcers. Flask-shaped ulcers in the cecum. Please learn. Cecum mein ulcers bleed. So patient have dysentery. I'm not saying diarrhea. I'm saying bloody dysentery. Patient have abdominal pain, bloody dysentery. Because of the flask-shaped ulcers which are bleeding in the cecum. Patient have pain in the cecum area. Say yes. Got it? Not only this. Cyst kuch nahi karta bichara. Seedha saadha hai. Cysts do not cause anything. Okay. The trophozoite are moving in the portal vein. They are moving in the portal vein. They are reaching the liver. In the liver, they produce the abscess. It is known as anchovy sauce abscess. anchovy sauce sepsis, the trophozoite are doing. And if you cut it, the brown color pus will come. That's why it's known as anchovy sauce on the posterior superior surface of the right lobe of the liver. After that, it will move in the hepatic vein, it will move in the IVC, it will move in the right side of the heart, and then it will move to the lung. The next abscess is produced in the lung. So 3 organs are involved, people. सबसे पहले intestine, extraintestinal में hepatic and lung, hepatic and pulmonary. So there is the hepatic abscess and lung abscess. So that is the 3 organs involved. That is amoebiasis. This is intestinal, and these 2 are extraintestinal amoebiasis. How many of you got it? So this is the disease. We have seen the life cycle. We have seen the disease. So what is the root? What is the, now tell me the diagnosis, what specimen you will take. For intestinal one, what specimen you will take, and for liver one, what specimen you will take. For intestinal one, we will take the stool. We will take the stool. What you will get in the stool? And what for liver, what you will take? You will say, ma'am, aspirate the pus from the liver. We will do a sonography, guided sonography, and we will aspirate the pus in a test tube. So this is the pus from the anchovy sauce abscess. So let me give you 3 options. In the stool, you will get only trophozoite or cyst or both. Or in the pus, you will get only trophozoite or cyst or both. These 2 are PYQs. So obviously in the stool, you get both. You can see in the intestine, both are present. So both will come in the stool. But in the pus, only trophozoite will be there. Both will not be. How many of you got it? How many of you got it? Now on this page, 20 MCQs. Can I summarize the 20 MCQs in front of you? Can I summarize my first question? Mode of entry, mode of transmission. Say, ma'am, ingestion. Tell me the infective form. Say, ma'am, quadrinucleate cyst. See, I have drawn. Tell me, where does excision occur, rupture occur? Say, ma'am, small intestine, the rupture occur. Tell me the organ in which the pathogenesis occur. Say, ma'am, cecum. First in cecum, then in liver, and then in lung. Okay, extraintestinal are 2. So intestinal and extraintestinal amoebiasis. Right. Here, flower-shaped ulcers are there. They bleed. They cause dysentery. Here, anchovy sauce abscess is there. And here also, abscess is there. And diagnosis, in the stool, you will get both. Cyst and trophozoite. But in the liver and in the lung abscess, you get only trophozoite, not cyst. How many of you got it, people? This is the way. Now you can fill this chart. You can fill this chart for Entamoeba histolytica. I want you to fill this chart for all the parasites. Now, just understand it once. In the exam, you don't have to draw this. No, you don't have time to draw this. But once you have drawn it, understood it, now learning is very easy. So in this way, I have explained all the parasites and you can learn the charts. The summary is the charts. You have to just learn the charts. How many of you got it? Give me a thumbs up. This is Entamoeba histolytica. Okay, now the last thing I want to teach you, the axe in parasite. Oh, definitely you are going to get one question on the axe. Can I come on the axe? Let me come on the axe. The complete ag, all ag at one place. No one will teach you all ag at one place with such a simplicity. Definitely you are going to get an image-based question or a simple question on ags in parasitology. So I taught you there are 2 types of parasites, protozoa and metazoa. Protozoa, we have seen only one, the important one, Entamoeba histolytica. The rest are provided in the charts. You have to read the charts in that way only. In the metazoa, I want to teach you ags. From the metazoa, you're definitely going to get a question on the ags. There are 3 types of metazoa: cystode, trematode, nematode. Okay, how many types are there? So metazoa, helminth or metazoa, they are of 3 types: cystode, trematode, nematode. Now my point is that I will show you the classification simultaneously with their ag. So see the classification. There are 5 cystodes. I will tell you all 5 ags. I will tell you the 6 types of trematodes, all 5 or 6 the ags. I will tell you 12 types of nematodes, ags of all of them. So see the classification, and along with the ags. Got it? So coming on the cystodes. Okay, coming on the cystodes. You can see cystode, trematode, nematode. Cystodes are elongated. They are known as tapeworm because they are flattened anteroposteriorly. Tape dekha hai? Sellotape. Have you seen a sellotape? Kabhi dekha hai? Inch tape, sellotape. They don't have cavity. They are flattened anteroposteriorly. That's why known as tapeworm. The cystodes are known as tapeworm. The trematodes are the shape of a leaf. Patti ke jaise hai, leaf. That's why they are known as fluke. The fluke is like a leaf. And the nematodes are cylindrical in shape. They are like cylinders. That's why known as roundworm. So first learn, parasites are of 2 types. Protozoa, metazoa. Metazoa also known as helminth. I want you to learn the 3 types of metazoa. Cystode, trematode, nematode. Abhi I will teach you the acts of all 3. Cystode, trematode, nematode. Cystodes known as tapeworm because they are flattened anteroposteriorly. Trematodes are known as fluke because they are leaf-shaped. And nematodes are known as roundworm because they are cylindrical in shape. Say yes. The first thing, the basic, you got it. Now let's come on the cystode, है ना? Before coming on the egg, है ना? Eggs, they all give eggs, है ना? Nematodes, many nematodes are viviparous. They directly give birth to the babies, to the larvae. I mean, in nematodes, they all do not give the eggs in nematodes, but all cystodes give egg. All nematodes give egg. In nematodes, not all. Only few of them give eggs. I will tell you that. So all cystodes we have to see, all nematodes we have to see. Nematodes, में few we have to see. Now, whatever egg we get, the egg in human stool. Egg in human stool, है ना? Human stool or human urine, we are getting the egg, or sometime in sputum, we are getting the egg, है ना? So whatever egg we are getting, we have to do two things of the egg before seeing their diagram. We have to see the two things for the egg, है ना? Egg of the parasite, which is present in the human stool. The egg, is it yellow color? Yellow color means bile stained. It is bile stained. I will say B positive. Or is it not yellow color? It is transparent. So I will say B negative. It is non-bile stained. Hana? So first see the color of the egg. Is it yellow or transparent? You have only two options. So first thing, Hana, I'm a microbiologist. Okay. I'm having a stool sample of my patient. My patient is having diarrhea, dysentery, and the clinician, you are a clinician. You are suspecting, madam, some parasite egg. Hana, take the stool sample. So we are taking the stool sample. We are making a saline growth of that. Hana, and we want to see egg in that. So first thing I will see, if I find the egg, is the color. Is it yellow or transparent? If it is yellow, I will say B positive. It is bile stained. If it is B negative, it is transparent. Got it? Now only 4 eggs are transparent. Neha. N-E-H-A, Neha. The mnemonic is Neha. Neha is transparent, or Neha is non-yellow. You can learn. N is Necator americanus. है ना? A is Ankylostomata duodenale. These two come together, bhai bhai. है ना? E is Antrobius vermicularis. And H is Hymenopsis nana. H nana. So learn the 4, you get questions on that. These 4 eggs are white color. The diagram will be different. Rest all are B positive. Okay. The second thing, you have to take namak pani ka ghol, saturated solution of NaCl. Take a glass and mix water. Take salt, mix it. Namak pani ka ghol, saturated salt of NaCl, and put the egg in that. There are two options. Ya tareka ya dubega. The egg will do two things. Now either float or sink. Hai na? Some eggs float, you can see, and some eggs sink. So the one which float, I will call them F positive. Can you see this one is floating here? This one. And can you see this one is sinking here? I'm showing you this one, sinking. So either the flag will float. So you have to tell me for each and every egg, you have two options. Ma'am, is it B positive or B negative? Huh? Or is it F positive or F negative? And then tell me the diagram of that egg. Khatam. Bas, itna hi story hai. Got it? So let's start it. So let's start it. Cystodes. The cystodes are in front of you. I'm not reading the classification. I guess you know the classification. Tinea solium, Tinea saginata, H nana, D latum, and Echinococcus granulosus. है ना? The 5 cystodes. I guess everyone know. ठीक है? इनमें से D latum have a different egg. Rest all are same. D latum have a different egg. Rest all are same. Rest all I will take together. Rest all I will take together. Rest all I will take together. So I will show you only 2 diagrams, जिसमें all the cystodes are covered. Shall I tell you? Huh? So see, D latum. D latum is something unique. You can see this is D latum, Diphyllobrothium latum. The egg have a topi, cap. The cap is known as operculum. The topi is known as operculum. The topi or the cap is known as operculum. It is operculated. Rest all are non-operculated. The remaining all are like this. The remaining all have an embryo, and the embryo have six hooklet. You can see 1, 2, 3, 4, 5, 6. It's known as hexacanth larva. What it is known as 3 pairs of hooklets, it is known as hexacanth larva. So remaining all are like this. So this is the cystodes. So if I say Tinea solium, it's like this. Tinea saginata, it's like this. If I say H nana, it's like this. Echinococcus granulosus, it's like this. But if I say D latum, it's like that. Say yes. And B and F you can read. B and F of each of them. B positive, F negative, F positive, B negative, whatever you have to learn. Say yes. Neha alag se learn kar lo. Say yes. Got it. People respond. No one will tell you such a simplicity. We are done with cystodes. Coming on trematodes. The trematodes are in front of you. है ना? यहाँ पे cystosoma के अलग है, and remaining all के अलग है. Remaining all के अलग है. So I will tell you 2 X now. Different for the cystosoma. Remaining all at one place. Remaining all flukes at one place. Can I tell you cystosoma? Maximum questions come on cystosoma. By the way, cystosoma is of 3 types. है ना? Cystosoma hematobium, cystosoma mansoni, cystosoma japonicum. See the 3 cystosoma. Cystosoma hematobium have a terminal spine. T for terminal. T for tobium, T for terminal. Say yes. Tobium, hematobium have a terminal spine. Mansoni have a lateral spine. Mansoni have a, how to learn? Tedi mansi. मेरे पास एक mnemonic है. Tedi mansi. है ना? So Mansoni have a lateral spine. ठीक है? And Japonicum have a knob. No spine. It's have a knob. है ना? जापान में knob होता है. Learn the mnemonic. So learn the three things, है ना? Learn the three things. Hematobium have a terminal spine. Mansi टेढ़ी, है ना? It's having a lateral spine. And Japan में knob है, no spine. देखो वो दोनों spine है. These two are spine. This one is knob. So learn the three cystosoma. We are done with three cystosoma. Okay, got it. What about the remaining all fluids except cystosoma? We are seeing the cystosoma. What about the remaining all? Huh? Remaining all these. All these. इनका diagram क्या है? What's the diagram of their eggs? Again with a topi. Egg with a topi. है ना? Egg with operculum like dilatum. Operculated eggs. They all have operculated eggs. Say yes. है ना? Coming on nematodes. Last. We are done with cystodes. The summary is in front of you. Trematodes. We are done with cystodes. The summary is in front of you. So I taught you 5 cystodes. 1 egg is different. Rest 4 is this. है ना? I told you 5 trematodes. है ना? One egg is different. Rest 4 is this. है ना? Now let's tell the nematode. Can I come? समझ में आ रहा है? You are getting it. So let's come on the nematodes. The last thing. After that, I will end the session. ठीक है? Nematodes. The nematodes में I will tell you only these eggs. I will not tell you these because these are viviparous. They directly give birth to the larva. They don't have eggs. They don't have eggs. So of course I cannot tell you. But these one I have to tell you. So how many eggs? I will tell you. है ना? Ascaris lumbricoids, I will tell you. Necator americans and canis and ankylostoma duodenale, these are bhai bhai. They have similar. So one of Ascaris, one of these two hookworms together, है ना? These are known as hookworm. तो दोनों के hookworm के साथ में आ जाएंगे. One of strongyloids, है ना? One of Antrobius, one of Trichuris. I will tell you 5 facts right now. 1, 2, 3, 4, 5. That's it. है ना? That's it. We are done with parasito. Let's start with the first one. Ascaris lumbricoids. Ascaris lumbricoids have 2 type of facts. है ना? Fertilized and unfertilized. What do you mean by fertilized? Now there is a male, there is a female. They are different. They will come closer. They will do the sexual intercourse. Female become pregnant. Female become gravid. She will lay the egg. So such an egg is known as fertilized. Because of sexual intercourse, the eggs are formed. Sometimes the female is alone. Male partner is absent. Still the female can become gravid. Yes, in absence of male partner, the female is laying the egg. Such egg is known as unfertilized. So these are not real egg actually. These are unfertilized. So these are the eggs which are there in presence of male partner. Male, female, both are present. Here the male is absent. Only female is present. So such is unfertilized. You can see this is spherical. This is elongated. It is having a thicker covering. Thicker. This one is having very thin covering. It actually have the embryo, this one. This have a atrophied ovum. It is not a real egg. It is having an atrophied ovum. Okay, you can see. Acha, how to differentiate? ठीक है, shape तो different है, coating is different. Acha, both are yellow, both are B positive. Concentrate, both are B positive. You cannot differentiate. Both are yellow. See the diagram, see the color. But F is something that differentiate. This one float, namak pani ka ghol. It is floating in saturated solution of NaCl, and this one is sinking. This one is not floating. You can learn F for F. The fertilized one will float. Fertilized one will float. Unfertilized will not float. So you get a question, which one is floating? How to differentiate the 2 eggs of the Ascaris? We are done with Ascaris. Coming on the next two together, the hookworms. Ankylostoma duodenale and Necator, these are together known as hookworm. The egg is in front of you. नेहा में आते हैं ये दोनों NEHA नेहा का N and A है ये. This is Necator americanus and this is Ankylostoma A. So that's why the egg is white in color. It is transparent. You can see it is B negative. It's B negative, F positive. It's B negative. And the egg contain of blastomere having 4 blastomere. Segmented ovum having 4 blastomere. Unique egg, hookworm. Is it Ankylostoma duodenale or Necator americanus? I do not know. But one of them. You will get the option 1 only. You will not get both as option. ठीक है. The next is the strongyloids. Strongyloids के egg में already larva, rhabditiform larva, बनाया. As soon as the egg come out, it will hatch. It is oviviviparous. So you can see the rhabditiform larva inside the egg. And Antrobius vermicularis. In the Antrobius vermicularis, the shape is typical. It is plano-convex. The shape of the egg is like this. Plano-convex. Appreciate the egg. It is Neha ka E. That's why white in color. Neha का E है, Antrobius vermicularis, and it contains a tadpole larva. This was rhabditiform larva, it's yellow in color. This is tadpole larva, it's transparent in color. Last is Trichuris. The shape is barrel shape. Can you appreciate the barrel having 2 mucus plug, barrel shape, the 2 mucus plug. We are done, people. Neha, you already know. These 4 eggs, the Neha is transparent. Transparent means B negative. They all are bile negative. How many of you got it? Say yes if you got it. Say yes. So I hope I have told you acts of complete parasitology in the cystodes. I told you helminths or metazoa. ठीक है? सिस्टोड, ट्रेमेटोड, निमेटोड. लेट्स रिवाइज क्विकली, ठीक है, टाइम नहीं है. सिस्टोड्स में आई टोल्ड यू डीलैटम अलग एंड ऑल अलग, है ना. यहाँ पे सिस्टोसोमा अलग, द 3 सिस्टोसोमा, हेमाटोबियम, मैंसोनी और जर्पनिकम अलग एंड ऑल अलग. और निमेटोड्स में आई टॉट यू 5, एस्केरिस लुम्ब्रिकॉइड्स, है ना, हुकवॉर्म्स, दोनों हुकवॉर्म्स साथ में ले लो, नेकेटर अमेरिकनस एंड एंकाइलोस्टोमा डियोडिनिल, ये दोनों हुकवॉर्म्स. इसके बाद मैंने कौन सा लिया था, स्ट्रोंगिलॉइड्स, स्टर्कोरेलिस, एंट्रोबियस, वर्मिकुलरिस एंड ट्राचुरा ट्राचुरस. ओके, आई गेस टाइम इज नॉट देयर, अदरवाइज मैं सारे बना दूं. यहाँ पे डीलाटम में कैप है ना, ऑपरक्यूलम वाला एग है. यहाँ पे द एम्ब्रियो विद अ हेक्साकांथ लार्वा, याद आया. यहाँ पे टर्मिनल स्पाइन, यहाँ पे टेढ़ी मानसी और यहाँ पे जापान, याद आया. टर्मिनल स्पाइन, टेढ़ी मानसी एंड जापान, ठीक है. यहाँ पे अगेन ऑपरक्यूलम, अपेन टोपी, है ना, ऑपरक्यूलम. एस्केरिस में आई टोल्ड यू द 2 टाइप, फर्टिलाइज्ड, अनफर्टिलाइज्ड, एक स्फेरिकल है, एक एलोंगेटेड है, ठीक है. यहाँ पे आई टोल्ड यू विद 4 ब्लास्टोमियर, याद आया, है ना. नेहा का है, दे विल बी ट्रांसपेरेंट, 4 ब्लास्टोमियर. स्ट्रोंगुलाइड स्टर्कोरेरिस में रैबिडिटिफॉर्म लार्वा. यहाँ पे प्लेनो कॉन्वेक्स होगा एग and it is having the tadpole larva. And last one, it is barrel shape. I tried to summarize also, people. I mean, I tried my best. So please, you are going to get the questions on that. This is the summary. How many of you got it? How many of you got it? Huh? So that's the summary. I tried my best to give you the gist of entire microbiology in just 4 hours. Still, if you have any query in microbiology, you can ping me on this number. It's my contact number, 9833032948. You can note down, you can save my number, and I'm available on WhatsApp also, I'm available on Telegram also. And with this ID, I'm available on Instagram also. So on all social media platforms, I'm available by this ID, that is MedLife by Dr. Priyanka. So whatever is your query in microbiology, in entire microbiology, you can ping me. And once you have cleared your exam, don't forget to ping us, anyone from the team. It's very happy moment for the teacher, for any educator, once the student get cleared in their exam. So all FMGE aspirants, I wish you best of luck. My heartiest wishes are with you. I have belief in you, and you have to keep my belief. Okay, you have to get cleared, give your best shot this time only, and you are going to rock. Thank you so much, wishing you all the best. With this note, I would like to end the session. I hope you find the microbiology useful, and it is the complete crush of the microbiology. I have given you the ultra important points, okay, that you must revise before going your exam. Thank you so much. And I must end the session right now. Thank you so much. Bye-bye. Wishing you all the best for your exam once again. And I know you all are going to rock. I know that. Give your best. Whatever is your best, है ना, जितना कर सकते हो इसी बार कर डालो. If you get selected, of course you will be happy. If you don't get selected, you will not feel bad. You will not have regret that gosh, I wish. ये बहुत पिंक करता है, ये बहुत पिंच करता है बाद में. The regret is something more worse than failure. If you are failed, it's okay. But if you have regret that उस समय पढ़ा होता तो आज फेल नहीं होता, वो ज्यादा बुरा है. So give your best, है ना. You will definitely clear. But नहीं भी हुआ तो regret नहीं आएगा कि that was the best. उससे ऊपर तो क्या ही करते, मर ही जाते हो उससे ऊपर. So that is the best thing, है ना. The best advice I can give you right now at this last moment. Thank you so much. Bye bye. Wishing you all the best. Bye. I'm ending the session.